Hello, hello, hello. Let's see. There we go. We are live. Hello, my friends. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, August 9th, and it is time for another live support group meeting. And I'm just getting my computer all set up here. Oops, what did I do here? All right. Is this any weird? Hello, Nancy. It's nice to see you on YouTube. We are simulcasting live on YouTube and Facebook right now. We are bringing Zoom on in about an hour and a half for patients who want to ask their own questions. I am just getting everything set up here. And I don't know why that's just so weird. Hello, Donna. How are you today? Hello, Facebook. Hello, hello, Facebook. Trying to get everything set up here, my friends. Set up here, my friends. Now, I have to tell you. So my name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network, the longest serving IC support group leader in the United States. I am the national IC support group leader. This is a national IC support group meeting. Actually international, because we often have patients from other countries, from Europe, South Africa, Australia, New Zealand. Everybody is welcome here. Hello, Annie. Hi, Julianne. Hello, Laura. Hello, Shirley. It was a wee bit late this morning because my mom wasn't feeling so well getting up. I had to try to get her up. There you go. She's 91. My purpose in doing these support group meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again, right? I don't want anybody to be able to say to you that this is all in your head and have you believe it. Listen, for anybody who even remotely suggests that this is an emotional disease, you're going to ask them, then why is my bladder bleeding? Or why are my muscles so tight I can't empty my bladder, or whatever, So it comes with knowledge. I want you to be able to do what I do when I encounter people who are rude and aggressive. I hit them with facts. I hit them with solid information, research, and facts. Science, my friends, is our friend. But I have to show you something. Okay, so last week I ordered this, right? Because I really wanted to show you so that you could really understand your pelvis. And it fell apart. It's all together. This goes to show. Remember, Dr. Jerome Weiss, one of the national IC leaders and pelvic pain leaders, he makes a very, very good statement, and that is that Western medicine fails when it comes to working with pelvic pain. Why? Because specialists stay inside their box. They don't go outside of their box. They don't understand influences, or they don't evaluate the influences of different structures in the pelvis. So a urologist is going to stay in the urinary tract. A gynecologist is going to stay in the reproductive tract. A gastroenterologist is going to stay in your bowel. And there's really no MD other than a physical medicine specialist who is going to really study muscles. Of course, orthopedic surgeons really like bones. But you know what? Look at this. This is a small, confined area. This is the hub of the human body, right? And the way the human body is designed is the bigger the bone, the more weight it is meant to carry. So the biggest bones in the human body, obviously, are your hip bones. So your pelvis carries the weight of your torso, right? But also, your pelvis is a communication hub because it provides, look at the holes, right? Right? I mean, there are holes. Okay, so it is a communication channel. Nerves go from the spinal cord through the pelvis down into the legs. Blood vessels go from the heart down into the pelvis and through the legs. And that's just the beginning. Because, of course, we have muscles. We have a ton of muscles because these are the muscles that help you walk. They help you open your leg one side or the other, right? So these muscles are very dynamic and three-dimensional. I always say your muscles go from left to right, front to back, and low to high. And they do. And then, of course, in the middle of it all, we have organs. We have a uterus, right? Okay, so hold on a sec. I want to, I was just dying laughing here at the breakfast table trying to put this all back together. All right, so hold on a sec. Okay, that bone has fallen. That bone has fallen off. Okay, so the first thing that we put on is the levator ani muscles, right? So these are the muscles at the base of your pelvis. These are the muscles that control. So here it is from front to back. So look, it starts here and they go all the way back, right? These are your shallow muscles. And these are the muscles that have holes in them. So what makes the levator muscles so critically important is that they're the only muscle group in the human body designed to control major bodily functions. They control major bodily functions. And you can see if this muscle is tight, it's going to be painful to have sex, right? Because the vagina would be much slower. If much smaller. It would be being compressed. The same with the urethra. You can see the urethra right here. If you're, remember back 20, 30 years ago, when I was one of those, I was diagnosed with urethral syndrome when I was in 11th grade. I mean 7th grade. My urethra was incredibly narrow. What did they do? They dilated me massively. I had probably 100 urethral dilations over 2 years to try to force those muscles apart or force the urethra apart. But nobody ever really asked that question. Why is it tight in the first place? It's tight in the first place because the muscles were tight. And I remember falling and hurting my tailbone, right? And look, remember we talk a lot about tailbone injuries? Well, here's your tailbone right here, right? So it curves. It curves like this, right? Doesn't go like that. It curves like this. So look, here's your tailbone right here. So if you have fallen and broken your tailbone, and your tailbone is skewed to the left or skewed to the right, you can see directly how that's going to influence the muscles. And the muscles on the short side might be overly tight. I mean, come on, guys. There's influences here. You cannot look at structures in isolation in the pelvis. They influence each other tremendously. If your muscles are tight, it's going to make it hard for you to urinate. It's going to make it hard for you to enjoy intimacy. It's going to make it hard for you to have a bowel movement. It's no secret that for people who struggle with constipation, the underlying problem is often incredibly tight muscles, right? And the same with vulvodynia. If you've got vulvodynia, why? Well, yeah, the vulva can be the result of estrogen atrophy. The vulva can certainly be irritated by chemicals, but if your muscles are tight, they could be squeezing the nerves to the vulva and the blood supply to the vulva, which could be triggering vulvodynia. So, and as we can see right here, here's the vulva right here. So you can see if these muscles are tight, it's going to directly influence vulvar behavior. So anyway, I was just dying laughing because I could not put this together. Okay, so I guess the bowel goes in. Does the bowel go in first? Okay, so hold on a sec. See, I'm just, hello. How many college degrees does it take to put together an anatomical thing? Now, see, that doesn't work. Wait a second. Okay, and hold on. My pelvic floor just fell off. Hold on, we got to put the pelvic floor back on. I mean, the levators back on. Okay, hold on. The levators are back on. The bowel is in. Okay. Let's see if we can if I can put the uterus in. Woo! Come on, get in there. The uterus is too big. I'm telling you right now, the uterus is too big. Oh no! Oh my! My elevators fell off. My elevators fell off again. I think I need 2 hands here. This is hard, guys. Okay, so look that. Okay, the uterus is in. Yes, the uterus is in. Okay, the bladder. Okay, how the hell does the bladder go in? What? Okay, wait a second. Oh, come on. You would think if I could do anything. It would be to put a bladder bladder in, right? Okay, well, no, that just does not look right. What is wrong with this bladder? It's not fitting in the urethra. Okay, okay, the bladder's in. Okay, living proof. It's living proof how complex the pelvis is, right? Okay, and I'm sorry, but the bowel fell out. Where did the bowel go? Does the bowel go in like that? Okay. Well, anyway, listen, I'm making my point here. I'm making my point here. When you've got IC, when you've got pelvic pain, if you have any pelvic pain conditions at all, you have to understand that focusing just on the organ is a flaw. It is a flaw because you can see how crowded the space is. You can see how crowded the space is. They absolutely influence each other. There's something called the viscerosomatic reflex. What does that mean? Can an organ change muscle behavior? Oh, hell yeah. If you have an organ that is tight, that is painful and throbbing, your muscles are going to get tight to protect you. We know organs change muscle behavior, but can muscles also change organ behavior, also known as the somatovisceral reflex? Absolutely, yes. And I'm going to take the bladder out. This is hysterical. Okay, oh, the uterus is coming out. Oh, I'm sorry, I'm giving her a hysterectomy. Not to take that lightly since I had one 3 years ago. But on the inside, you can absolutely see that the pelvic floor muscles really are the core and the center of where things are located and held in place. If your pelvic floor muscles are weak, you have the potential of dealing with a prolapse, with things falling. If your pelvic floor muscles are tight, then you're going to have issues with blood flow and circulation. And so, as I say, oh, look, and here's another piece I missed. What is this? Okay, this goes right here. Oh, this goes, okay, that goes over the sacrum. There you go. And now here's another interesting piece. So look, obviously this is L5. This is your lowest vertebrae. And then underneath this, you see we've got this triangular bony structure right here. This is your sacrum. It's your sacrum. And you see these 4 holes right here? Those are holes that nerves come out of. And they come out this way. They come out forward. And these are the early branches of the pudendal nerve. So what happens is the nerves come out of these holes and they go through muscle. They go through muscle, then they merge, then they go through something called the Alcock's canal, and then they split up again to innervate all of the structures. Oh, okay, something fell off again. So this is okay, get back on there. This also shows you how easy pudendal nerve entrapment happens. Because if you've got a nerve coming out here and then you've got a tight muscle that's pushing on that nerve, hello. What is it? The bladder is connected to Suzanne, the bladder is connected to the hip bone. Anyway, I just thought, actually, I was hoping it would have more movable muscles, darn it. But I think it does. I just have to figure it out. Okay, well, anyway, that's enough of that. So I normally do these meetings in 3 parts. The first thing I do is I'll do a little 30-minute, 45-minute mini lecture and announcements. The second thing that I will do is take your questions. We will start a Zoom meeting where you will be able to ask questions, etc., etc. Need to take a moment at the beginning and thank our sponsor, Preleaf. For those of you who are unaware, Preleaf is the oldest supplement that's been used by the IC patient community. It reduces acid. So if you're going to eat something you shouldn't eat, pasta sauce, anything at all like that, Preleaf can be very, very helpful. And hold on, I'm fixing my computer here. The bitter. All right, the bitter. There we go. Thank you, Annie. Hi, Julianne. Hi, Laura. Hi. Hello, Shirley. Hi, Patty. Hi, Maria. Julianne says, I had a bad week this week with 3 days of bladder spasms. Holy moly, girl. What do you think triggered your bladder spasms? Hi, Veronica. Hello, Elena. Valerie, having the worst flare up right now. Valerie, what kind of flare are you having and what do you think triggered your flare? Tell us. Hi, Steph. Valerie says she has no clue. I broke my tailbone in my 20s. Girl, yeah, tailbone injuries are common in pelvic pain. Julie says I'm funny. Yeah. John says, I'd like my pelvic floor to fall out. Hello, Gay. Hi, Brenda. Hi, Joe. Hi, Sarah. All right. So anyway, you guys are cordially invited to a special online event on Thursday, which is some of the attorneys that are representing IC patients in the Elmeron eye lawsuits are going to be taking questions. And I announced it on our website. Hold on one sec. Kind of at a slightly odd time. It's Thursday late afternoon. Hold on, let me get it for you. You have to sign up in advance. Yeah, if you go to icnetwork.org, it's under news and feature stories. Lawyers representing IC patients in the Elmeron lawsuits invite you to a special Zoom meeting so that you can ask questions. The guest speakers are Aaron Dickinson and Krista Basich. They're both partners in a law firm called Kruger Dickinson. They have a lot of experience with cases like this. And so it is this Thursday at 3 p.m. Central Time, which I think is 2 hours ahead of Pacific Time. So I think that makes it 1 Pacific Time and 4 Eastern Time. You can sign up. I will post a registrations link. You're not going to be able to get the login details from me right now. They will send them to you. And so if you would like to ask questions about the lawsuits and or if you are considering a lawsuit, think about it. Please know that statute of limitations is getting shorter and shorter. Some states are 1 year, some states are 5 years. And so if anything at all, if you have used Elmeron, and even if you're not showing eye issues now, we have one research study that shows that it can progress. And if you're asymptomatic now, that doesn't mean that you might not have symptoms in the future, even if you stop the medication. So I would suggest that you learn your rights, because I don't know about you, but I'm pissed off about the whole thing. I'm furious about the whole thing. To think that some patients are having to choose between going blind or bladder pain is nothing short of disgraceful and astonishing. And so in my opinion, I think that the lawsuit should go on. I think discovery will be very interesting. It's going to be fascinating to see what kind of documentation the companies produce. And when they knew eye issues were happening, we already knew that it was happening before it was even FDA approved in 1996. And so I think we have a very, very good reason to hold this company accountable at this point in time, or multiple companies accountable. So again, I posted the link. You can sign up for it. It's free, but you can just go on over to icnetwork.org, right? icnetwork.org, and read about it there and read about the speakers and their histories and things like that. Jody says, I have macular degeneration but never took Elmeron. Yeah, because macular degeneration can also be genetic and hereditary. And it can be with the result of injury too. I mean, I'm not saying everybody, but our own research study that we've done, we have over 2,000 patients who have participated in the IC Network study. 54% are reporting retinal disease. 54%. It's astonishing. And that data is held up for 2 years. It's not swinging one way or the other. It's staying right around 53 to 54%. Jody says, I have Tarlov cyst disease. It's nerve root cyst in the sacrum that compresses the nerves. I've had surgery, but my bladder, urinary tract, and vagina burn constantly. So guys, oh wait, hold on. My uterus fell out again. Okay. No. Oh my God. This is hysterical. Okay, get back on there. Stop it. Wait, hold on. Wait. Get on there. Really, seriously, stay. Okay. So what Jody has is Tarlov cyst disease. So what happens is you get little tiny sacs of spinal fluid that come off of the spine right at the nerve root right here. And so you can get Tarlov cyst really basically in any one of these holes. And if, unfortunately, if it's compressing a nerve which is uh, important to your pelvis, you're going to feel it, right? Unfortunately, you're going to feel it. Generally, what they have to do is surgery to remove the cyst. And Jody here says she has Tarlov cyst disease. Jody, I don't know. I don't remember. I mean, it's been so long since I actually researched Tarlov cyst. If they know what causes the Tarlov cyst, do you know? Jody says, how do you relax the muscles that the nerves run through? Well, Jody, you know, this is where you have to go to a physical therapist at least once. So remember, your pelvic floor is like a three-sided box that's open in the front. So you've got low muscles, obviously the lowest muscles, which are your levator muscles, which if they get tight, that's really hard. You've got a mid-level of muscles, and then you've got the deepest muscles, which are the ones on the side, which are the piriformis muscles. And the obturators, the adductors are in there too. Anyway, we have to figure out first which muscle group is involved. So for me, it is, see, it's hard. It's this upper muscle group. That's my group. That's always tight. In fact, I did 45 minutes of stretching and exercises this morning before I started because I was really feeling it, because I gardened yesterday. So each muscle group has its own unique protocol, its own unique stretches that are needed to try to get this muscle to relax, because as you can see, they go in different directions. So you've got muscles that go up the side. I'm sorry, I got to figure this out. This is the first time I've tried to use this as a demo. It's hard. Wait, is that better? Yeah, there you go. Right? Okay, so we have to look on this side. So we've got muscles that go up the side along the base of the hip bone, and we've got muscles that are lower that kind of go from front to back, and the lowest. So it all begins with figuring out which muscle is the issue, and then the physical therapist should be able to help you. You don't do Kegels. A Kegel would only make your muscles tight. That's the last thing we want to do is a Kegel. You know, a lot of IC patients, you just want to do it. I've worked with many patients over the years who, man, they just go to town on their Kegels. And they end up in much, much worse shape because Kegels are designed to strengthen muscles. They're not designed to relax muscles. There's something called a quick flick where you tighten for a second and then release for 3 seconds. But it's kind of like a Kegel where you tighten for a second, release for 3 seconds, where you're really focusing on the relaxation phase. But in the Kegel, you tighten and you hold for 3 to 4 seconds. You don't want to do that. It's all about the relaxation. And you guys, hey, Donna makes an important point. Hey, listen, if you find these meetings, would you please like our Facebook page? Please share it in your Facebook groups. Put on it. You can share it on your feed if you want. If you don't want to, that's okay. I won't take it personally. But I really need you to go over and like our YouTube channel where our videos are. Because I can do more. The more likes we have over there, the more I can do. And so you have to work your way through this fairly rigorous viewer count to be able to open up more privileges. So if y'all could go over to youtube.com/ICN Jill, that would be great. And follow that page. It's free. Okay, so a couple of you had flares. Gudu says, please accept my friend request. You guys, I'm not on Facebook that often. I come on to do these, but honestly, Facebook it gets a little frustrating for me sometimes. If you want to see me kind of more regularly, I'm on Twitter every day. Twitter.com/ICN Jill. Or twitter.com/IC network. Jody says her Tarlov cyst can't be removed. It's ballooning. It's a ballooning of the nerve wall. Mine were drained, plugged, wrapped, so they can't refill. They use the lining of a cow's heart to wrap the cyst. Holy moly, girl. They don't know the causes. I've been dealing with bladder burning for over 10 years. There's only 3 Tarlov specialists in the US. Hey, Jody, if you would like to share your story, I would love to do an article on what you've gone through and the challenges that you have faced in getting treatment for your Tarlov cysts. My email address for anybody out there is icnetwork@mac or Macintosh computer, icnetwork@mac.com. Hold on. All right, that's better. So Jody, if you could email me, I would really love to talk to you a little bit more and see if we can create maybe some new resources to help other patients with Tarlov cysts and really share your story. Because as you know, if you have Tarlov cysts that are driving your symptoms, spending $20,000 on bladder therapies is kind of a waste of time, because the bladder therapies will never fix a Tarlov cyst. And that's why subtyping is so good now. Now we can give patients much more clear diagnoses so that you can focus your money and your time on the therapies that will help you the most, right? Jody says. Okay, so C. Lamar on YouTube, just diagnosed with interstitial cystitis last week. Welcome, welcome, welcome. I'm so sorry. But on the other hand, you are absolutely not alone. And you are now beginning this journey of trying to understand your anatomy. You know, I always say to everybody, and this absolutely stands, no matter how long you've had IC, when you go to a doctor, do not walk in and say you have IC. You're going to fall down the rabbit hole of old beliefs. That's the last thing we want to do. You've got to be able to walk into the doctor's office and discuss your symptoms really, really clearly, because we need them to study this. We need them to study your anatomy. And we need them to look at muscles. We need them to look at organs. We need them to look at a lot of things. And when you say you've got IC, unfortunately, a lot of them just go, all right, this is somebody I doesn't want to work with. And they just throw Elmeron at you or something else at you and get you out of the office. Whereas there's a chance that you might actually have something that's curable, like a fibroid tumor. If you have a fibroid tumor pushing on your bladder, we know that fibroids will trigger frequency, urgency, pressure, pain. And we had a research study presented last year which showed that if you fix the fibroid, you remove the fibroid, guess what happens? The bladder symptoms go away. That would be considered a cure in the vast majority of patients with fibroids who have urinary symptoms. If you've got endometriosis, that could be an issue. If you've got if you've got chronic fungal infection, if you've got a chronic bacterial infection, there are just so many other related conditions that we're now ruling out. And most importantly, what we're ruling out is muscle injuries, because for a lot of patients, their symptoms began after some sort of pelvic trauma, like a fall or a tailbone. So CLMR on YouTube, tell us, what do you think triggered your IC? I'd love to hear that. Can you associate any unique event or any specific event that you think started this whole thing for you? Let's see here. Hi, Deb. Deb says, met with my urogyne 2 weeks ago, dumped the Elmeron with no problems, using Vesicare for urgency. Your pain is low and infrequent. Things are looking up. Thank you for the support and the words. CLR says, 10 years ago, you had a ladder accident that caused whole body whiplash. There you go. See? How many times do I have to say it? Guys, so many of you, especially men, especially with the men that we work with, we can usually find some sort of pelvic trauma. So she says 10 years ago, she had a ladder accident. Your lumbar took the brunt of the trauma. And so how soon after that ladder accident did your urinary symptoms start? I would like to hear it. I mean, was it a week? Was it a month? Was it a year? Just out of curiosity, how quickly after that bladder accident did your bladder symptoms begin? And you guys, please know that if I miss your question, it's nothing personal. Just please ask it again. There's a lot happening on my computer right now. C. Lamar says it happened. Her bladder symptoms started 2 years after her accident, and you waited 8 years to speak to your doctor about it. Oh. All right, so you truly are an anatomical mystery to be solved. She says it felt like a bladder infection, but no infection ever happened. That's right, because the bladder only knows one language: frequency, urgency, pressure, pain. You could have a bullet wound or a stab wound, and it would feel like an infection. So the only language that the bladder can use you to tell you that you've sustained some sort of injury is frequency, urgency, pressure, pain. And you're just like all the rest of us. You thought it was infection over. You listen, some people have taken antibiotics for a decade, never getting better because it was never their bladder in the first place. It was a pelvic injury or something else that was triggering it. Elizabeth says, dental drugs brought out a flare a few weeks ago. Pain, wasn't thinking, new dentist, urologist moved last year, Hunter's lesions. So if you had epinephrine, your dental anesthetic normally contains a little bit of epinephrine, which kind of makes your heart race and all that sort of stuff. And that can definitely set off the bladder. C. Lamar, it's probably really bad that I used cranberry supplements for 8 years. Yeah, definitely. Definitely. But we all did that. I drank a quart of cranberry juice a day for a year, not having a clue. And at the end of that year, I was in the hospital with the pain was so bad because I had no idea the damage I was doing with the cranberry. So what you need to have, because your symptoms began after a really significant fall, you need to have a proper pelvic floor assessment to see what's going on with your muscles. And maybe even see an orthopedic surgeon to have them study your pelvis and see if there's anything else anatomically that's going wrong. As an example, as I talked about before, could your tailbone be out of position? Could your tailbone be out of position? That's a possibility. If it is, it's going to tweak your pelvic floor. And I kind of want to go over the subtypes, but not quite yet. And I know, see, you need that. Let me just say this. Around the world, doctors are now very clearly kind of in this professional contest, for lack of a better term, to create the perfect subtyping system or phenotyping system. And that is a system that will identify all the unique variants in the IC patient population, because we are absolutely not the same. For some of you, IC begins in childhood. For others, after menopause. Are you the same? Hell no, you're not the same. For some of you, IC begins after chemotherapy, while for others, IC begins after having a baby or a rape. Are you the same? No. IC is literally a grab bag diagnosis. If you've had frequency, urgency, pressure, pain for which they cannot find the cause for 6 weeks, that opens up the interstitial cystitis diagnosis. But that doesn't necessarily mean that it's a real bladder disease. There could be lots of other things that are going on. And all you have to do is look at the bladder to see the variations, because some of you have big wounds on your bladder. Others, like myself, completely normal bladder. Are we the same? Absolutely not. So I use a system created by Chris Payne, who ran the IC research program at Stanford University. He focuses on 5 core variants of IC. I have a video over on our website here on Facebook and YouTube that talks about that in depth. So I'm just going to fly through it really quickly. IC subtype 1, Hunter's lesions, which we now believe are probably viral infections. We have that was first discovered in Europe. And now we have our first American study through the National Institutes of Health that was released a couple months ago, which indeed also found chronic viral infection in some of you. A small subset, but some of you. For those people on the internet who keep saying IC is a chronic bacterial infection, they're wrong. They're wrong. Because now we have several research studies linking viral infections. Number 2, we also have a research study linking fungal infections. I'll talk about that in a minute. But at least now we know why patients with Hunter's lesions didn't respond to Elmeron and other therapies. Because it's a viral infection, it would be an antiviral. Hi, Suzanne. She says, how am I? I'm good. And it's nice to see you again, too. IC subtype 2, bladder wall driven, because the bladder, like any other part of the body, can be injured. There's no doubt about that. But generally, it's injured through some sort of chemical exposure. And so if you've gone through chemotherapy, or you had an absolutely terrible diet, or you were using the wrong drugs like ketamine, those have the potential of really damaging your bladder wall. So if you were addicted to diet soda and you only drank diet soda for a decade, I'm telling you right now, your bladder wall would have a very hard time protecting itself from that constant daily acid load. So we know your bladder is driving your symptoms if you have pain, as your bladder fills with urine that is relieved by urination. So the fuller you get, the worse you feel. Ow, ow, where's the bathroom? For God's sake, it hurts. And as soon as you pee, you feel a sense of relief. That is indeed points us to the bladder wall. Vicky says, has a virus been identified? A couple of viruses have been identified. The most common virus associated with quote unquote hemorrhagic cystitis, which is cystitis that bleeds, causes bleeding in the bladder wall. So we know the virus infects the bladder wall, is called the polyoma, B as in boy, K as in Kelly. Polyoma BK. That was the first virus that researchers in Europe 6-7 years ago identified only in the urine of patients with Hunter's lesions. We now know that Epstein-Barr, the Epstein-Barr virus has been found in the bladders of some patients. And the National Institutes of Health study, using next generation DNA testing, identified another polyoma virus, the polyoma J virus. And I think, I don't know, either I had an article on that in our last magazine or I put it on the website. I don't remember. But anyway, we've been talking about this for a couple of months. So IC subtype 1 Hunter's lesions. IC subtype 2 bladder wall driven. Oh wait, hold on, I'm not done with that. Okay, so again with bladder wall driven. Variant number 1 is chronic infection. Oh my God. I'm a little hyper. And I apologize. I'm a little hyper today. I don't know why. That's so weird, except I did this whole exercise, so maybe I've got good blood flow going through my body. So let me calm down. Let me take deep breath. Everybody take deep breath. In. Out. In. Out. Okay. I'm grounded. I'm grounded. Okay. So in the bladder wall driven subtype, we have 3 variants. Number 1, chemical injury. Number 2, chronic infection, chronic fungal infection. That was another research study that was released by the National Institutes of Health, which found that for many of you you were flaring because you had an overgrowth of candida in your urinary tract. Now, guys, this is solid science here. If you flare when you eat sugar, if you flare when you eat carbs, that points us to a potential fungal infection. And the problem with traditional urine testing is it doesn't test for fungus. So here you've got all the symptoms of infection. You're sure you got an infection. And the test doesn't test for, a urine culture doesn't test for fungus. And so, what do? You're telling the doctor, it's infection, it's infection. The doctor goes, all right, I'll give you antibiotics anyway. Well, what does that do? That actually causes the growth of more fungi. And that is why patients are now doing next generation urine testing, because that will identify bacteria, good bacteria, bad bacteria, and fungi, and even in some tests, viruses. And let me, all right, get my little slides out here. So if you want to learn more about next generation urine testing, just go to bladderhealth.org. Bladderhealth.org. All right. The third thing we're going to look at with bladder wall driven is estrogen atrophy. So if your symptoms started after a hysterectomy or with perimenopause or menopause, that's explainable with the loss of estrogen. Because it turns out your bladder What makes the bladder such a cool organ is it's the only organ in the human body designed to hold toxic waste because it's got ammonia in it and urea in it and all sorts of funky things like that. So how can a healthy bladder hold ammonia for hours at a time and not get damaged? And the answer is your bladder is like your mouth. It is a hollow organ covered with a thick coating of mucus. We call it the mighty mucus, and that mucus acts as a barrier. It protects the skin underneath. And so, you've got a layer of mucus, a layer of urothelial cells, and underneath that, blood vessels and nerves and things like that. Well, that top mucosal barrier is estrogen dependent. So when you're young and you have lots of estrogen, you have lots and lots of mucus. When you get older and you start losing estrogen, what do you think happens? Your mucus gets thinner and thinner and thinner. And once your periods stop and your ovaries are basically not functioning, your skin gets remarkably dry. Remarkably dry. And so if you have irritation on your vulva as you're urinating, so you feel, we call it urine burn, where your urine feels really, really hot, like it's actually burning you. It's not burning you. It's not hot. That's a measure of the quality and health of your skin. So if you have burning on the outside while you're peeing, that is a classic symptom of estrogen atrophy. If you've got discomfort in your urethra, if you feel like there's a drop of urine stuck in your urethra, if your urethra is just irritated, that also points us to estrogen atrophy. The urethra symptom often comes first. Hold on a sec. Somebody had a question here. Jane says, so are doctors now treating Hunter's IC with antivirals? They're just starting to study them now. I found one research study that talked about antiviral therapy for patients with IC that was promising. And I believe that I referenced that in the article that I wrote. And where is it? Hold on. So this is our, we're working on the summer run right now. This is our spring IC Optimus. So for those of you who want to stay informed and you don't like reading stuff online, sign up to become a member and you can get this from us. Very proud of this. Where did I put that study? Let's see here for a moment. Is it in this one? Cultivable pathogenic bacteria not found in the urine of women with IC. Right, we know that. We know that. The vast majority of patients do not have chronic infection, but some of you do. Well, listen, log into your account if you're a member and just go back and download your other magazines. It's in there. It's in there. Okay. All right. So how do we treat estrogen atrophy? As I was working with an absolutely lovely woman on Friday, a little bit of estrogen. If you give your body a little bit of estrogen, it will start producing mucus. And so generally what happens, especially if you're older and you haven't used something like that before topically, it will feel very hot at first. It doesn't mean that it's burning you. It's, again, a measure of the quality and health of your skin. But every subsequent time I used my estrogen cream, the heat got better and better and better. And so now whenever I use it, it feels like a little tiny warm puff of air, warm air. That's gone in a second or two. So if you use estrogen cream and it's super, super hot, that tells us that your skin is probably pretty messed up. Pretty dry. Vicky says, I'm having flares from oxalates. So Vicky, the operative question here is, yes, oxalates are really well known for being irritating because they're crystals. They're sharp little crystals that would irritate your bladder wall. But the real question is, why is your bladder wall and your vulva vulnerable to oxalates? And the answer might come right back down to the quality and health of your skin. If your vulva is dry and your vagina is dry, so is your urethra and so is your bladder. And generally, the estrogen cream that I see patients do the best with is a compounded estradiol cream rather than a brand name like Premarin or Estrace. And the reason why the brand names are a little bit more challenging is because they put more preservatives in them to enhance their shelf life, and they're also wickedly expensive. Premarin can cost, $250 a prescription, whereas my estrogen cream costs $50 a prescription. So that's a huge difference. Dawn says, tell me about Bladder Builder. Hold on, let's just come back to that. Let me finish the subtypes. Okay, so IC subtype 2, bladder wall driven, we're dealing with chemical irritation, chronic infection, and estrogen atrophy. IC subtype 3 is a pelvic floor muscle injury. Because if your muscles are messed up and they're tight and they're restrictive, they're going to make it very hard for you to be able to have a normal bladder. If your bladder is not getting good blood supply, it's very hard for your bladder to be healthy. People ask, well, why am I diet sensitive if my number one problem is my muscles? And the answer is that it's impossible for your bladder to be healthy if it doesn't have good blood flow. I call it the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor? They're both involved to some degree because they're so incredibly interconnected, but one is generally driving the other. And so if your symptoms began after a traumatic injury, like C. Lamar here on YouTube, listen, you could take bladder therapies for a decade or longer and never get better, because it's not addressing the fundamental issue. And the fundamental issue is poor circulation and blood flow. So if your symptoms began after a muscle injury and you have tight muscles, yes, your bladder wall is going to become involved. Yes, you're going to probably have some diet sensitivity. But if you've taken bladder therapies for years and you're not improving, that's when the American Urology Association says, hey man, take a step back. Let's revisit the diagnosis. Do we know what we're doing? Do we know what we're treating? And for some of you, you've completely missed the muscle stuff. And for some of you, you don't like anybody working on your muscles. You want a pill, but a pill's not going to fix a muscle. The way you fix muscles is with muscle work. And the beautiful thing about this subtype is curable. This is curable. Muscles respond beautifully to muscle therapy, provided there's not some sort of bony structure abnormality too, right? So if you've just got a severe muscle injury, they can do hands-on muscle work, and muscles respond beautifully to muscle therapy. Muscle therapy, in the big research study that was released in 2008, outperformed every other bladder therapy. And when that study came out proving that muscle therapy was helpful, if not the most helpful, the IC world was turned on its head, because at that point in time, people had to go, uh-oh, wait a second. Maybe this isn't just a bladder disease. Maybe for some of you, there's a muscle issue going on. IC subtype 4 is pudendal neuralgia. This is a nerve injury. So these patients have positional symptoms. You're fine when you stand, but when you sit down, it hurts. Or you've got a sciatica or electrical pain shooting down your legs. Or if you've got a vibration or a buzzing, like if you're sitting on a cell phone on vibrate, or if you've got pins and needles, like on your vulva, that point, or around your rectum. Or for gentlemen, oh, and guys remind me, there's a fascinating new study for guys out there. If you have driven positional symptoms, then that points us to muscles that are compressing a nerve. And so again, our therapy is going to be focused on relaxing muscles, number one, and number two, calming the nerves down. The last subtype is IC subtype 5, central sensitization. And that's the inherited subtype. We tend to have very sensitive skin. I'll let you watch the video so that you can learn more about that. But hold on a sec. I got to find this for a moment. So there was a new study that was presented at this year's AUA, which was all online. I was going through all the research 2 nights ago. And it was a study about testicular pain in men. And what they found was that a significant population of men with testicular pain had a hip problem. It was a hip dysfunction that messed their muscles up, which then triggered the pain. Here we go. We've got yet another research study that is validating the role in pelvic organ health. Where did I put that? Is it open? Here it is right here. I've got all the abstracts for all the research studies right here. Let me find it. I was really excited to see that because you know what? Listen, for us women, you know, yeah, a lot of women out there think that we have it harder than men. We don't. If you're a man with pelvic pain, you are often condemned to a diagnosis of prostatitis. And you are often condemned to years of prostate medications and antibiotics with no effectiveness. And so we have to understand that this is a significant challenge for both men and women, and having a proper anatomical assessment of the pelvis and its related bony structures is so important. Elizabeth says, I notice hiking is better for me than walking the track. More muscles are used. Hi, Andrea. Nice to see you. Valerie says, where do I get my estrogen cream? I use a mail order pharmacy called the Women's International Pharmacy. Their website is women'sinternational.com. And they are located, I think, in Arizona. And they have been absolutely wonderful to work with. I'm really happy with how easy they are. And they don't pay me to say that. It was my gynecologist who told me to use them. Because, hello, super sensitive skin. Why does it always get so hot when I do these? All right. Thank you, Casey, for sharing that info. Jody makes a very, very important point, and that is that persistent genital arousal disorder, also known as PGAD, is often a sign that the nerves coming from your sacrum, your sacral nerve roots, are being traumatized in some way. And in her case, I'm not sure if that's your case or not, but in sometimes that's caused by tight muscles, and sometimes that's caused by Tarlov cysts. Sonia says, my physical therapist treated my nerve problem this past spring with a very simple treatment. She used a washcloth to gently run across my upper thigh and lower abs. This desensitized my nerves and the pain is mostly gone. The pain would start most often when I was sitting and relaxing. Let's try this again. My physical therapist treated my nerve problem this past spring with a very simple treatment. She used a washcloth to gently run across my upper thighs and lower ab. This desensitized my nerves and the pain is mostly gone. The pain would start most often when I was relaxing. I'm just thinking anatomically, what could be happening there? I mean, that makes total sense because we know, but it makes sense in a couple of different ways. I mean, we know that if you slap your thigh, right? So like you just slap your thigh right this. That creates a distraction for your lower brain. And so one of the ways that we reduce pain is by giving your brain something else to pay attention to. You have something called the spinal gate. And the spinal gate only lets the most important pain messages through. And so if you create a diversion from your IC pain by slapping your thigh, that's kind of something you can do in the car if you're having a flare while you're driving. At least that's what I did. I even flew to Europe doing that from California. And then I also had a TENS unit that I put on the inside of my thighs that I turned on, and I would turn it off and on and off and on to try to create that diversion. Another thing that happens is something called allodynia, where the nerves proximal to the original injury also become irritated and sensitive. And so I know I went through a point where for about a month or 2 months where you couldn't touch me from my waist down. You couldn't even gently touch my skin, like even the simplest touch caused a lot of pain for me. And that's because the nerves in the area had become extremely sensitive. I haven't heard, so I understand what she's saying. And girl, if it worked for you, great. I think that makes total sense. Okay, Dawn wants to know about bladder builder. So let me grab it. Let's just do this. I did just add a page over in the IC Network shop about transitioning from Elmeron. For those of you who are trying to get off of Elmeron and you don't know what to do next, I'll be putting a big link on that. Right now, the link's at the bottom of the page, or it's under shop by condition on the IC Network page. All right, so Dawn wants to know about supplements. Supplements have been used for over 20 years in the IC patient world. And one of the reasons why they've been used is because literally only one oral medication was ever approved for IC, and that is called Elmeron. And so it was researchers at UCLA who first discovered that quercetin had an antihistaminic effect in the urinary tract. And one of the ways we describe IC is it's kind of like 100 mosquito bites at once in your bladder. For those of you with bladder wall injuries, wherever urine finds a weak spot in your bladder, it will cause mast cells to release histamine, just like a mosquito bite would. So having something that has an antihistaminic effect makes sense. So the very first supplements, aside from Preleaf was the very first supplement, which is just a calcium pill to reduce acid, right? Okay. Was Cystacue and Prosta-Q, and they are kind of done, but they were the first one that was released. Like I'm going to say like 20 years ago, 25 years ago, about 25 years ago. The next supplement that came onto the market was Desert Harvest Aloe. And that's a very interesting step. Very interesting. A company was started by two sisters, one of whom had IC. One of them did aloe, felt a lot better, followed a hunch, thought, you know what? I wonder if aloe would help other people. Aloe is known for its very calming and soothing effect on wounds. And so aloe in the bladder can be, and especially the urethra, might have a calming and soothing effect. Our challenge with aloe is that a lot of people are aloe intolerant and they have gut reactions to it. Even the most highly refined organic anthraquinone-free aloe that has removed all the dangerous substances to the aloe plant. There's still some of you who try aloe and it gives you nausea and or diarrhea and gut distress. So aloe, again, not what I would call a top tier supplement. The next supplement that was created by Dr. Theo Herides, a federally funded National Institutes of Health IC researcher, and he created Cysto Protect. And he was the first. It's an interesting story because he's a researcher, MD, pharmacologist at Tufts Medical School, and the state of Massachusetts asked him to investigate the safety of supplements. And as he was doing that and looking at their methods of action, he was like, I wonder if this could help IC. And, you know, he is a man, he is a geek's geek. This guy is science driven. I love him dearly. He made huge strides forward in our understanding of IC. He was the one who really understood the whole mast cell connection. And here he is doing this project for his state. And he is introduced to kind of the world of supplements. And so he designed a supplement just out of curiosity to see if it would help. And he created Sister Protect. And this, within a month, became the top supplement because it has two methods of action. It has quercetin for the antihistaminic effect, but it has chondroitin and hyaluronate for a bladder coating effect. And now, 20 years later, we just had another big research study that was released at the European Society for the Study of IC this year, which found that chondroitin is the most effective at kind of restoring the surface integrity of the bladder wall when you put it directly in the bladder. But that's not approved in the United States. So we don't have bladder installation, chondroitin bladder installations in the United States or hyaluronate bladder installations, but they're available in Canada and Europe. So we know chondroitin is a critically important ingredient. So Sister Protect just dominated the market. Patients, thousands of patients have used this quite successfully. Some it gives nausea. You know, we always say with patients, when you're going to try a supplement, take one, see how you do. One a day for a week, see how you do, go up. I will tell you, for me personally, when I tried Sister Protect, I never got to 2 a day. When I got to 2 a day, it gave me a loose bowel. But when I took it once a day, it felt like warm cotton candy in my bladder, and I thought it was interesting. But I had to eat it with food. If I didn't eat it with food, my stomach was a little rocky. All right. So anyway, hold on a sec. I need this one. The next supplement that was created about 7 years ago, was Sister Renew. You know, when Dr. Theo created Sister Protect, and God bless him that he did because he's helped so many patients, they sold the U.S. licensing rights off to this. And so when they did that, he signed a non-competition agreement, so he could not update this formula. And we've learned a lot about IC in the last 20 years. And so unfortunately, this is an older formula. It still helps a lot of people, but it's older. And so a new doctor stepped forward, Dr. Gio Espinosa, who runs the New York University Integrative Urology Department. And his website is Dr. Gio, G as in George, EO.com. He has a fabulous blog. Seriously, sign up for it. He's so good. He created what at that time was the next generation supplement. So it has quercetin for the antihistaminic effect. It's got chondroitin for the bladder wall effect. But he put in a little bit of magnesium for the relaxation effect of the magnesium. The most important ingredient that he put in here, well, he put 2 more ingredients in it, aloe vera, and then the most important ingredient was lemon balm. Now, this is not citrus lemon. Lemon balm is a mint with a lemony scent, but lemon balm has been shown to calm nerves down. And when we think of our IC subtypes, IC subtype 4, IC subtype 5 involve nerves that are very irritated. So using something with lemon balm made sense. So Sister Renew came out, and I'm going to say, 3/4 of the Sister Protect users who switched to this really loved it and stuck with it. And 25% basically said they like Sister Protect and they went back to Sister Protect. Kim says, is Heplido A still available? And the answer is no. No. You have to go to your compounding pharmacy and see if they can do it for you. The license for that expired. Okay. But again, one of the challenges with this supplement is the aloe. And so many of you are aloe intolerant. So this just was not viable for a lot of people. So, I mean, this is still out there. Patients still use this, but it's okay. It's okay. And the cool thing here is you got tons of options. So about 2 years ago, a group of us, myself included, just started talking about what's the next generation supplement? What can we do in terms of a supplement that might be more helpful? And I just want to say here again, the American Urology Association, in their IC guidelines, in step 1, encourage supplementation rather than Elmeron and amitriptyline, and that's all in step 2. They want patients to try the supplements first. Why? Because there's so much clinical experience with them. If you were a patient of Robert Evans or Rob Moldwin or Ken Peters, the odds are they talk to you about supplements. The AUA recommends supplements because they have fewer side effects than Elmeron, which we now know could potentially cause blindness. So this is viable. This is really, really viable as an option. So Bladder Builder was the next supplement that was built. And Kara says, what about pumpkin seed oil? Pumpkin seed has really been studied more with prostate inflammation than the bladder. Although I do believe there's a new supplement that's currently being designed called Flare Guard that's hopefully going to help during flares. And I think that has pumpkin seed in it. Marshmallow root bothers about half of the people who try it. And so marshmallow root is known for potentially helping be slippery, for lack of a better term. But again, about half the people flare who do marshmallow root. So anyway, we're all just sitting around talking, going, all right, wait a second. We still don't have a supplement that has a pain fighting effect. And so over a period of a couple of years, Bladder Builder was developed. This has been out now for about a year. We just did our 1-year follow-up study. And so it has the chondroitin for the bladder coating effect. It's got the quercetin for the antihistaminic effect. It's got various critical vitamins. It's got collagen for the bladder wall. It's got probiotics in it for the gut, because we now have research that shows that, again, from our own National Institutes of Health, that the biome in the IC patient is often abnormal. So it uses some probiotics to try to restore the biome. But the most important ingredient in Bladder Builder is palmitoethanolamide, also known as PEA, which is the pain fighter. And this is important right now because so many of you have been thrown off of your pain medicine. So to be able to have something with a proven pain fighting effect is important. So how did this happen? PEA, palmitoethanolamide, has been used in Europe for well more than a decade for a wide variety of pelvic pain conditions. Pain conditions. Lots of pain conditions. In fact, Suzanne just on YouTube just says Peora 500 for pain is saving me. Okay, so let me finish this and I'll explain what that is. So PEA has been around for 20 plus years. I'll get there, Amanda. 20 plus years. It's been used extensively in Europe. It's been studied extensively for pain. It has consistently, in condition after condition after condition after condition, has been found to be helpful for chronic pain. Last year, the Italians produced the first ICPEA research study. And the data was stunning. They presented the data to the American Urology Association last year in Chicago. And what it found, so they had a population of patients who didn't respond to any other therapy. And they gave them a combination of palmitoethanolamide and resveratrol. At month 3, 87% of patients had a significant reduction in their pain. At month 6, 25% of these patients were symptom-free and pain-free, and the rest had significant reductions in their pain. So when that paper was presented, all the IC doctors there got really, really excited because, of course, you're all asking for pain help, but they don't want, because of the opiate crisis, they don't want to give opiate medication. So here we have something that's an over-the-counter product used extensively in Europe that is now available in the United States that can help reduce pain. And interestingly, I just want to say that 20 years ago, we had a couple of compounding pharmacies importing PEA for IC patients here in California, but it was thousands of dollars. And it was just not viable financially. But I mean, this is not known, but to have this research study showing that IC patients unresponsive to other treatments did really well with PEA was promising. So Bladder Builder is the first supplement that not only provides the antihistamine effect and the bladder coating effect, but it provides the pain fighting effect. We just did our 1-year follow-up study. Be perfectly honest, I just published it on our website last week. About 60% of the patients who started it kept taking it, and 40% stopped. And the ones who stopped because they couldn't afford it. It's about $50, $49, or the doctor wanted to try another therapy, or they had a side effect. The side effect profiles were really small, usually gut distress, but still 40% of the patients chose not to keep using it, 60% did. But of the 60% who kept using it, the results were incredibly encouraging. 25% were pain-free. Another 25% had a significant reduction in their pain. Their flares were shorter, their flares were less frequent, and their flares were less painful. And so Bladder Builder is exciting. But one of the reasons why people might react to Bladder Builder is because it has probiotics in it. And some of you are sensitive to probiotics. If you have a histamine issue, some probiotics trigger flares. And I didn't understand that at first, but it was, we did an article on it in our last magazine. It was Gay Sandler, the author of Patient to Patient Managing IC-Related Conditions, who explained it, that there are some probiotics that trigger a strong histamine response that would give you potentially a flare. So if you flare taking a probiotic, then you definitely don't want to take Bladder Builder. So that brings up Bladder Rest. Bladder Rest is a really clean, simple formula for people who are more sensitive. So Bladder Rest is just, it's like Sister Protect, except it's in a vegetable capsule. So it's got chondroitin for the bladder wall. It's got quercetin in it. It's got sodium hyaluronate in it. And it's got L-arginine in it. And it's in an avocado base rather than an olive oil base, because unfortunately, Sister Protect's really hard to ship in the summer because the capsules melt. Karen says, was Bladder Builder in a double-blind study? Not yet. The Bladder Builder formula was first tested and vetted by one of the top IC researchers that we've been working with for some time. It was used in his practice well before it came out in public. Double-blind studies are incredibly difficult to do, and and that's something that I think this company would like to do, but they have to be fine. You know, you got to be willing to commit a couple $1 million to do it, and right now that money isn't available. That's why you don't see supplement companies doing a lot of double-blind studies. The only supplement company that did a double-blind study was Desert Harvest Aloe. They did a very small double-blind study of 10 to 12 patients. That's it. All right, so for those of you who are sensitive, Bladder Rest would be viable. But the newest supplement is this one, Allopath. So there's no doubt that aloe works for some people. There's no doubt it does. Again, we're dealing with the gut distress. And so the conversations about Allopath have been going on for well over a year and a half, if not longer. Wanted to create a formula that enhanced the soothing ability of aloe. And so Allopath contains aloe and PEA for the pain fighting effect. And so this just takes aloe to the next step. It gives it, hold on. Patty says, just received Bladder Builder and Allopath. You're stopping Elmerone. I'm excited. I really hope it works for you. Amanda says, are there probiotics in bladder rest? No, there are not. There are no probiotics in bladder rest. The last supplement is Peora. So Peora matches, very closely matches the formula that was used in Europe for, that formula in Europe is called UMP, which is a combination of resveratrol and PEA. Of course, we can't get that here in the United States. And so this is a stronger formula than the formula that was used in the research study of PEA and resveratrol. And it's got a little bit of calcium, a little bit of magnesium, a little bit of vitamin D3. There you go. And so this one does not have a bladder coating effect, but it does clearly have potentially a nerve calming pain reduction effect. So this would be the one for people with potentially pudendal neuralgia or more nerve driven pain. This is what I take. As a redhead, I get very, very sensitive skin. I have a lot of neuropathic pain. Like it's like being stabbed with needles sometimes when my nervous system gets really sensitive. And so this is a supplement that I will take when that starts to happen. And the nice thing about the PEA is that there are very, very, very few side effects. You can go to the National Library of Medicine and look up all the research studies with PEA, which is what I did. And I went through a couple dozen research studies. I only found one that reported side effects. All the other ones reported no side effects. And what we're finding is that the Peora is really very well tolerated by the patients who have tried it. And as Suzanne says here on YouTube, Peora Poly 500 for pain is saving me. I have a low tolerance for meds. One a day with breakfast works for me. Suzanne, I'm so glad it's working for you. Again, the motivation here was about pain. It is a crime that some of you have been thrown off of your pain medicine and are suffering and are not able to work again. And so you can see the excitement of being able to offer something that is proven in a very clear study to be remarkably helpful at reducing the pain of IC. Is to just have that as an option is exciting. But you know what? Like, I'm not God. I can't predict the future. I can't tell you what supplement is going to work for you or any. You just have to try and, talk to your doctor and see what they think. Hello, Ralph. Nice to see you. Marion says, I had burning in my bladder all the time in the past few weeks. I have terrible burning in my first hands, very, very bad on the left side of my back and the left ear. My general practitioner said it looks like I have peripheral neuropathy. And so I'm pretty sure that there was a PEA study with peripheral neuropathy. That would be logical. I mean, generally, if you've got peripheral neuropathy, we want to really try to figure out, number one, where the nerve is being compressed, if it is being compressed, and then number two, do things that will calm nerves down. And that might be topical anesthetics like lidocaine creams, but it might also be medications like gabapentin, which will calm nerves, but it might also be something like PEA. Katie says, what about D-mannose? D-mannose is not a therapy for IC. It is not a pain fighter in any way, shape, or form. A therapy for IC. What it can do is flush E. coli bacteria out of your urine. So if you're operating from the assumption that you are struggling with recurring urinary tract infections, doing something with D-mannose makes sense. But better than D-mannose is Prevent, which uses PACs and D-mannose. And so Prevent is fascinating and is probably the most, I don't know, like I'm a geek. I love all this. I love the research and I love the science. The same company that makes Bladder Builder makes Prevent, and they were asked to by Ken Peters, who runs the largest IC research program, because there absolutely is a population of older women usually who get recurring infections. And so having something that will help prevent those infections is viable. The top supplement in the market is Allura. Unfortunately, Allura is very expensive. And so they were asked to create something like Allura at half the price, and that's Prevent. It's stronger and more affordable. Rebecca says, I got the Jerome Weiss book. You recommended, and it's been a real eye-opener. Thanks so much for right. Rebecca, what has surprised you the most about? What surprised you the most? Elaine says, finally had my surgery. My bladder was stuck to my C-section scar. Holy hell. Girl, oh, I can't even imagine what that felt like. Ooh. You're hoping once I heal your IC, I bet they will be better. I really hope they'll be better. Rebecca says, I bought the book too, but I haven't started it yet. You're anxious to learn more. You guys, the book that they're talking about is this book. It is now the new Pelvic Pain Bible. It is fabulous. It is the best book ever written by far, 100%. And if you struggle with tight muscles, if you have vulvodynia, if you've been diagnosed with IC, if you suffered with any pelvic trauma, this book will be your lifeline. It is a master class in pelvic anatomy. And as you read it, what I want you to do, I worked with two guys. I did coaching sessions on Thursday with two men who were so interesting because again, with guys, you're diagnosed with prostatitis and tossed out the door. And in both cases, they very clearly had a major pelvic injury. They just didn't make the connection. And so when you read this book, you have to read it within the context of thinking about your body and thinking about what happened to you. Mohani says, can pre-leaf dispose you to kidney stones? Yes. If you are prone to calcium-based kidney stones, then you should not be taking any calcium supplement. You don't take pre-leaf like candy. You just only take it before a meal. Karen says, who owns the company that make the supplements? This is made by a company called Natural Approach Nutrition. Their website is naturalapproachnutrition.com. The CEO his story is nothing short of tragic. And he has a broken back right now from a chiropractor. So the guy who started Natural Approach Nutrition it's a really interesting story. Whenever I go through my email, it's like I have a little angel on my shoulder saying, this person really needs you, right? So even if it's on a Saturday or a Sunday, there are just moments where something whispers, pick up the phone or answer this email. So I get hundreds of emails. So anyway, I got this email from this guy who was just in terrible shape, just terrible shape. And he was really fighting for his life. And so I wrote this really long email back. He was a surgical malpractice case where a surgeon went in. He had some frequency urgency. The surgeon said, you must have a prostate issue. I'm going to do surgery and fix you. Well, the surgeon went in and destroyed him. And what happened is he blocked one of the critical ducts in his prostate that then developed gangrene. Now, this whole time, you can't magically look inside of your body, and he doesn't mind me telling this story. He says I can tell it to anybody, so I do. It's an important study because some of you are injury patients. Some of you are medical injury patients. So, here he's got all the symptoms, lots of pain, and so, I sent him the email. He responds back, and we end up talking. And he kept saying, Jill, it's this one spot. It always hurts in this one spot on my left side, right here, right next to my prostate. And I kept saying, dude, what's there? What's at that spot? Because I see patients a typical bladder wall patient does not have a spot. If your pain is always in the same location, we have to look at that location. What is there? And that's why when you go to the doctor, you don't say you have IC. It's like, doc, I have this pain right here, like right underneath my you-know-whats, right? Can you help me understand what this spot is? And so he's going back to the doctor again. He has no clue that the first surgery has been botched. And he's getting worse and worse and worse. And they go in He's had 13 or 14 surgeries in the last 3 years now to try to repair the original damage. Literally, in one of the surgeries, they go in and they find the blocked duct, and it's black powder, massive gangrene. They have to clean that out and all this sort of stuff. And I mean, crazy. And then in one of the later surgeries, they left a bleeder in his bladder. And when they sent him home, his bladder filled with blood clots. He goes back to the hospital. It is a complete emergency. They have to do emergency surgery. And literally, when they get into his pelvis to his bladder breaks open, splits in two. And literally, this guy is in agony. So then, of course, they clean out his bladder, they sew it up. And by this time, he's worked with, doctors around the country. And I kept saying to him, I said, dude, you're not a typical IC patient in any way, shape, or form. Let's get you to one of the best diagnosticians in the world, Ken Peters at Beaumont. So anyway, here he's in another state. His bladder ruptures. It's a disaster. Anything that could go wrong with this guy has gone wrong. And he is really fit, really strong, really dynamic. You would love him. I love him. He's a hero of mine now. So then the freakiest thing in the world happens to him. And that is that as he is recovering from this surgery where his bladder split in two, now remember, he's not an IC patient, guys. He's not an IC patient in any way, shape, or form. He starts passing kidney stones. And they were big kidney stones, like hundreds of them. Like, what the hell is this? Right? Like, oh my God, they were really bad, really painful, getting stuck. What happened is the surgery had damaged a calcium metabolism pathway in his bladder wall. And his bladder wall was now growing crystals. It looked like the Himalayas in his bladder. I have pictures of it. And so by this time, he's now finally seeing, one of the top doctors who goes in and goes, oh my God, this is what's happening. And they've had to surgically remove them a couple of times. He's finally stopped producing kidney stones, right? I mean, producing these stones erupting from his bladder wall. In fact, I have a picture on Twitter. I've shared it several times. So again, not an IC patient. You don't ever have to assume this is going to happen to you. I'm just talking about the CEO of the company Natural Approach Nutrition and why he got involved. So anyway, this whole time he's on the phone with me every couple of weeks, and I really have come to worry for him and want to help him as much as I could. And he finally, one day, we get him over the hurdle and we get him to the doctors, and it's all making sense. And by the way, the doctor that did the original surgery is in jail because he botched a whole bunch of surgeries. So he really is a surgical malpractice patient. One day he goes, I need to tell you who I am. And I was like, no, you don't. You can use fake names with me. I don't need to know who you are. He goes, no, I really need to tell you who I am. I'm like, no, you don't. You really don't need to tell me who you are. And he goes, well, Jill, I want to help. I had no idea. Patients ever went through anything like this. It turns out he is a fairly accomplished CEO who's had a lot of companies and has worked with kidney problems. And so he changed his career direction. He gave his company as a coffee company and a water company in the Midwest. And of course was having trouble working, obviously, because he was in terrible pain. And it changed his life. He's a different man now. And he had no idea people could suffer to the degree that he had suffered. I mean, listen, when you struggle with pain, pelvic pain, this is a whole different type of pain. This is organ pain. This is characterized by being relentless and difficult to ignore. It is agonizing. And it catalyzed a whole new approach for him. He wanted to help. And he basically said, how can I help? And we all, this whole group of us all just started talking. And what do you think happened? He ended up creating this new company, Natural Approach Nutrition. He'd already worked with the vendors, sourced everything in the United States, nothing from China. And he's kind of a master builder based upon his other very, very successful companies. So that's the founder of Natural Approach Nutrition, the makers of Prevent Bladder Builder. And so, when it comes to companies, I mean, the cool thing here is, I got to say, almost every company that's come up with a supplement did it because the CEO or somebody was affected. The Farr Laboratories created ProstaQ because the CEO had prostatitis pretty badly. Dr. Theoharides created Sister Protect because he worked with IC patients and knew how much they suffered. Desert Harvest Aloe was started by two sisters, one of whom who had severe pain. And so, this is not like a giant vitamin company trying to make a buck. I mean, I really think they have very, very severe and very, very solid intentions of sincerely wanting to help. And so I will just say that in my 27 years, I've never worked with a company more interested and responsive than Natural Approach Nutrition. I talk with them almost every day. And I'm absolutely thrilled with what they've done. I mean, I think it's really, really solid. So there you go. There you go. And again, surgical injuries happen. Surgical injuries happen. Just as for those of you who've had hysterectomies where they've lacerated your bladder and punctured your bladder, it is a possibility. Kim says, do you do your own bladder cocktails at home? Some people do. I personally don't. I don't need bladder therapies anymore. My subtype is not my bladder wall. My subtype is my pelvic floor. You know what? It's time to start the Zoom meeting. So hold on a sec. Let me go ahead and start that. Sorry, I got a little distracted there sharing this story. So one memento. So when we start the Zoom meeting, you can come into Zoom and you're basically going to get one-on-one opportunity to share your story, and I do what I do every day, and I tend to do coaching during those, where I'll ask you a bunch of questions, and we'll just see if we've missed something or try to give you some new ideas or something. So hold on, the Zoom meeting is starting. Okay, the Zoom meeting is now open, and let me go ahead and give you the invite. I think it expired from last year. All right, so Facebook, here is your invite into the Zoom meeting. Anybody who wants to come in, come on in. YouTube. Hold on. Hello, YouTube. I'm sorry you were hidden on my computer. There you go, YouTube. Please come on in to the Zoom meeting. I'm going to let you in one at a time. Guys, please remember, for anybody who's watching here, that this is a genuine support group meeting for people who are suffering. This is not the time to, come in and try to make jokes or make fun. These people are hurting. So we are here to help them. All right. So when you're ready, now with Zoom, what you do is you click on the link. It will ask you to download a little tiny program, and then you just use the program to join. If you need a password, let me know. All righty. Wanted to allow me to do bladder installations at home, but couldn't find a pharmacy to mix them. What other options are there? You know, some mail order pharmacies will actually, mail order compounding pharmacies will do the mixing and send it to you. And so the original pharmacy that did it was called Imprimus, but they just shut that down. They lost the heparin lidocaine contract like 2 years ago. So I don't have a new name. There's like 3. I might be able to find them. Hold on. Give me a moment here. Okay, I got to close that. So if y'all want to do Zoom, that's fine. If you don't, hello, Valerie, Patty. There's Julianne. So I'm letting people into the Zoom. Mohani says, starting pelvic therapy on Tuesday. Awesome. Now listen, Mohani, at your, and Kara says, is it the IC Network link? I clicked on it. No, it's not the IC Network link. It's the Zoom link. Hold on. Did the link not copy? Here it is again. I just added it again into Facebook. And my email is icnetwork@mac.com. After we're done on the week, I'll see if I can find those other pharmacies for you, okay? I will try to find those other I just don't remember what they are on the top of my head. There's one in North Carolina. I think there's one in New York. I'll see what I can do. Okay, so Mohani, let's talk about this for a moment. You're going to pelvic floor for the first time. Fabulous. And that you've been referred to pelvic floor physical therapy means that at least one doctor said, yeah, your muscles are tight, let's get it out. At your very first appointment, they are going to do a pelvic floor assessment. Their job is to study your body. And you've got to be able, I want you to, number one, walk in prepared to talk about your symptoms. Do you have pain on the left side or the right side? Is it low? Is it high? What makes it better? What makes it worse? And more importantly, I want you to be able to think about your history and any trauma. Were you an athlete? Were you a gymnast? Were you an ice skater? Were you in a car accident? Did you have a fall? Did you have a rough delivery? Anything at all like that. Give them clues as to your physical history here, okay? They need to understand that so that they can use that as they are studying your body. Now, what they will do at the first appointment, here, hold on, I got more people coming in. Hello, Andrea, Barbara, and Mary, y'all are coming in. What they're going to do first is start on the outside. They're going to look at your core. They're going to look at your legs. They're going to look, preferably, hopefully, they will watch you walk down a hallway because we want to see how you're moving. We want to see tension patterns. We want to see anything weird that might be going on with your muscles. You too, Ralph. Ralph says, take care. I'll see you later, Ralph. Call me if you need anything. Okay. So we want them to watch how you're walking. We want to see, is one leg longer than the other? They should be measuring the length of your legs. They're studying you physically, right? And then what they're going to do is do an internal examination. And this is literally the most important part. Oh, you know what? I wonder if I can do this. Oh, can I do this now? So this is the new model I bought, right? So remember, this is a good demonstration. So this is your pelvis from front to back, and this is kind of your pelvis looking down. And look, they can't, you can't reach these muscles from the outside because look, we got bones in the way, right? So yeah, they're going to study your abdomen. They're going to study your glutes and your legs, looking for tension patterns. But eventually, they're going to want to try to touch these muscles. And so they're going to do that. They're going to, and so again, there are 3 layers of muscles: shallow muscles, deeper muscle, middle muscles, and kind of deeper muscles. So here are the shallow muscles, the levator muscles, right? Then what they're going to do is they're going to insert their finger right? Gently up your vagina. And I wonder if I can do this. And they're just going to gently palpate, right? They're just touching, right? They're just touching on either side. Now listen. If they touch something that triggers your pain, that is a hallelujah moment. That is a, oh my God, that's it. What are you touching moment. Do not be afraid of the internal exam. It's brief. I mean, this is not going to be a 2 hour. This is going to be like 3 minutes, 4 minutes. So they're just going to have you laying on your back. Your knees will be up a little bit. You won't be in stirrups. And use a glove, use a little bit of lubricant, and they're just going to touch the shallow muscles, the middle level muscles, and the deeper muscles. And if you can see, I mean, when I had mine done, I think the part that was the most interesting is that, you're laying on your back going, what is she touching? I don't get it. What is she touching? And she was always, my physical therapist was always kind of going in a J shape. And this shows you what the J shape is. Look at that. With your finger, you can actually touch the bone. You can touch the muscles right over the bone. And so they will generally follow the muscle fibers. See, look, this is a really good example. There's your J shape right there. Look at that. See? So they're just going to touch different muscle groups. Again, if that examination, touching a muscle, triggers your pain, that is what I call a hallelujah moment. Don't be afraid of it. That's super exciting because that means they found it. And now it's her job to try to figure out what it is. Now, anytime you've got chronic tension in one area, you could have trigger points. So if you fell and you have a trigger point in there, or you had a rough delivery that stretched something out, you can have muscle knots. Like seriously, can you imagine? Can you imagine how painful a muscle knot would be right here? But we can get muscle knots right in there, right? I mean, it happens all the time. It's exciting. It's so exciting because you're no longer going to be condemned to taking bladder therapies for the rest of your life that never work. If you've got tight muscles, that's your therapeutic priority, is to work on those muscles. And you work on those muscles with a finger in your vagina or a glass wand in your vagina, which is what I do at home now when it happens. And so where is my glass wand? Where is it? What do I do with it? Hold on. All right. So when you do internal work, you're going to be using something like this. It might be straight or it might be curved, but the curving is better because it lets you reach more. And so if you can't get to the physical therapist, or even more importantly, if you're starting to feel your muscles get tight, this is when you can get in right away and calm that muscle down. It's so interesting because that's what I do now. I mean, I have a left SI problem. My SI gets out of joint, my muscles start spasming, and it's right on the left side. And I was just curious. I just got this. I wanted to see if I could. Okay. Okay, so again, oh God, I don't know if I can do this right. It'd be easier in person. Well, basically all you're doing is you're just going along the muscle fiber, right? See, look at this. There's the J shape right there. You're going back to front, and you're released and pliant. And that's exactly what the pelvic floor person is doing on both sides. It's so interesting. All right, where did my vulva go? Hold on. So if we put the okay, so these are the these are the middle level muscles. We put the shallow muscles back on, right? And if you ignore the tender bits, look, you can see the muscles, right? If these muscles right here, your levator ani, are messed up, you're gonna and look at back here. Oh, so here's another little interesting tidbit here. Why is the perineum so painful? You know, the perineum is that little bit of the tissue between your rectum and your uterus, or your rectum and the base of your scrotum. Why is that so painful? Because it's a muscle attachment point. Immediately above the perineum is something called the perineal body. And the perineal body is where four muscles attach. And if one of those is tight, it's pulling on all the other ones. And that's why the perineum gets so sensitive. So anyway, listen, I just got that model and I have to work on it. We need to bring a proper physical therapist on to talk about it in depth to you. Here, I'm letting Linda in. Okay, guys, so anyway, listen, y'all know that my job is to be an educator. I'm an educator here. I want you to get ideas, thoughts, concepts, and I need to kick you in the butt and get you back to your doctor and start asking questions. You are each an anatomical mystery to be solved. We are trying to help you understand the many different influences that can be triggering your pelvic pain and your bladder pain, right? Right. Okay, so we are now going to start the Zoom portion of the meeting. So for those of you on Facebook, for those of you on YouTube, you're going to hear this. We're going to let patients talk one at a time, and that's where a patient gets to share their story. And you can come on over to the Zoom meeting. I'm putting the invite back in again in Facebook. Oh God, I almost ended. Oh my God. I'm such a goober. All right, Facebook, you have the invite. YouTube, how are we doing on YouTube here? You guys already have the invite. I'll put it in again. If you want to come on over to Zoom, and then we'll be done with the Zoom portion, and then we will come back to Facebook and YouTube, okay? So here we go. Zoom. Now, you guys, I feel like we just need to roll the dice. I never who to call on first. I don't want anybody to be offended if I call you first or last. It's just spontaneous, okay? And in some cases, it goes by what I see. And so we're going to start with Patty, because Patty is ready to talk, I can tell. Patty, how are you doing today, girl? Oh, wait, hold on a sec. Wait. How are you?
I'm good. How are you?
You know what? Aside from being a little sunburned, I'm remarkably energetic today. I think it's because I did a good workout this morning. I feel like
I'm a little tired, PMSy.
Hey, girl, been there, done that. How is your IC? How is your pain?
Today I'm okay. It's like I said, my IC generally starts a few days after my period, so I'm gearing up for it to start bothering me.
Okay.
But I've been waiting for this Zoom chat pretty much all week, because I saw my urologist, my gynecologist, and my eye doctor all within like the past week.
Oh, okay.
Excited to share what I've heard.
Okay, tell us.
Well, the good news is my eye doctor was completely aware of the Elmeron lawsuits.
Okay.
And was like, yes, we're getting you back in here in a month to do the test to make sure there are no damage.
Yes. Okay.
The bad news is my urologist was completely dismissive of it.
Are you kidding? Wow.
No. She said none of her patients have had any problems and it's very safe and blah, blah, blah. And I'm just like, well, I have previous eye problems. I don't think this is a good medication for me to be on. But yeah. And I also wanted to ask you, because I was trying to talk to her and like, I want to get, this next gen urine tested for like the fungal and the stuff. And she was just like, she was dismissive of that too. And she ordered me, I don't know, just like a regular urine test for fungal stuff. And I wanted to know, what's the difference between the regular and this next gen? Like, what will the next gen find?
Now, and I don't know if this is true for a typical urine fungal test. It's usually done on a growth medium. So for anybody who took biology or microbiology, there's something called an agar plate. It's a round plastic plate that's about this size. And inside that plate is a layer of like white jello. And it's a growth medium. And it's food for bacteria. And so what you do is you put the urine, you swab some urine, kind of like in a thing like this, a zigzag effect. And then any bacteria that can eat that growth medium will grow. But it's limited to bacteria that will eat that growth medium. And so, again, presented at the American Urology Association conference last year, the reason why next generation testing is so much better is it doesn't rely on a medium. What it does instead is it just grabs and studies anything floating around in your urine that has DNA in it. And then it identifies the DNA sequence and it compares it with national databases to see, to identify what it is, number one, and then number two, to see if that specific DNA sequence is associated with a drug resistance. So the last I heard was that a typical urine culture relying on a single growth medium will miss 95% of the bacteria that could be in the bladder. Whereas a next generation urine test will identify everything in your bladder, good or bad. And the problem with the next gen test is that, number one, it's not approved by most insurance companies. Number two, it pushes doctors out of their comfort zone, especially if they aren't familiar with it. Understand that all the top IC research studies use next generation testing, or the vast majority of them do. But number three, interpreting the results is challenging because we have good bacteria and bad bacteria. And last week, and I forget who it was, we had somebody who had her next gen test, and it identified, what was it? Like, it identified a rare internal staph infection, a staph that is normally found on the skin and is fine, but if it's ever found internally, it's associated with some fairly serious disease process. So that was really, really interesting. So but again, it's, if doctors haven't been trained, if it's not something they're interested in, infectious disease specialists tend to be a little bit better at it. But some doctors use it and some doctors don't. It just is what it is.
All right. Well, I just wanted to ask because I was like, well, I didn't want to waste my money on this test that wasn't going to find, anything that, that I'd be better spent to spending my money on the next gen.
So what did they call the fungal test? Is there a name? What's the name?
It just says fungus, parentheses, RESP, comma, TISS, comma, other parentheses.
T is in
notes.
RBS.
RESP.
P as in Paul or T as in Tom?
P as in Paul.
Okay.
And then T as in Tom, ISS. And then on notes it says fungus and acid fast bacillus, AFB urine.
Well, I mean, that's outside my specialty. So I just don't, I don't know, but you know, what do I say? I like data. I don't like guessing. I like data. And I would have it. Why not? I mean, it's an interesting preliminary screen. And if they find anything weird, then you can go to the next generation testing. I guess the question I would ask is, will it provide any drug resistance information? Will it tell me if this is a candida infection, a candida glabrata infection that is resistant to diflucan? So
yeah, I don't know, because she was very dismissive about it. She's like, you're probably not going to find any fungal infection. Your urine looked great. So
well, and I didn't have it. I thought for sure I had a fungal infection, and when I had it done, I didn't have it. But it was meaningful information for me, because at least I didn't keep running down that rabbit hole of diflucan, which I was at one point in time. I did have a candida glabrata infection for 2 years, and it was incredibly painful, much more painful in the bladder wall than any other a typical IC flare. It reduced me to tears every single time, but it always flared with milk and anything with milk sugar, ice cream, yogurt, anything at all like that. And it took a good 2 years of really aggressive fungal antifungals to finally kill it. So drug-resistant candida infections are a real public health problem, and people are dying from them. So it's just good information to have.
Yeah. Well, I think my other issue is, like, ever since I was diagnosed, you know, after coming to a few of these meetings, you talk about, you know, bladder wall and pain when your bladder fills and goes away when it's empty. I have never had that. Like, the most I've had is like a couple of like lightning bolts of pain sporadically. So I'm not quite sure, honestly, at this point, I'm not quite sure if it's even my bladder, even though I dug out my pictures.
Yeah.
You can see here, you know.
Oh, wait. Put your picture back up again. Let me look at it.
All right.
Okay, so you got a handful of what we would call petechial hemorrhages there. Okay.
Okay. Yeah, I didn't know that, because, you know, it's like I had this cystoscopy, so it's like, well, it showed damage, but then, like, after being, you know, the Elmeron never did anything, the elimination diet never really seemed to do anything, and then a few of these meetings, I'm just like, I don't know if the bladder's the main cause anymore.
Right.
I'm just leaning towards it being something in the pelvic floor. And the other thing of note that I wanted to share was, like, at my gynecologist, he noted that he felt muscle tension and tightness in my vagina when he was poking around. So
well, okay, so again, you are the perfect representation of the typical IC patient. You just don't know. Is it your bladder? Is it your pelvic floor? Your symptoms are strongly associated with the bladder. Bladder therapies are not helpful in any way, shape, or form. And now we have a clue. We have a doctor who has said, gosh, you're pretty tight.
Yeah.
Yeah. So chicken or the egg. And that's the part that's just the most interesting here.
Yeah. And I told my urologist too, I was like, I've never really had pain in the bladder. It's always been lower down in my vagina. And she's like, oh, well, that sounds like vulvodynia, and that's outside my realm. And I'm just like, but you've never really examined me outside of the cystoscopy. Because the main reason I had my appointment with her, because I wanted to ask for a pelvic floor assessment.
Yeah.
I don't know if she got that. Like the most she did was she's like, I'll put in a referral to the University of Michigan vulvodynia clinic. And I'm sitting here wondering, I was like, well, do I want the vulvodynia clinic or do I want a pelvic floor?
No, you want I mean, cause and effect. Vulvodynia is an effect of often tight muscles or something else going on. You really want, in my opinion, I would be investing my time and money on understanding potential causes first, right?
Yeah.
And so you've already had one doctor say your muscles are tight. I would follow that pathway, and at least have a proper pelvic floor assessment and see if they feel anything, right? But honey, it's your life. You're the boss, and you got to follow your gut and listen to your doctors and learn as much as you can about it. Hopefully, you've got the book. Do you have the book, Breaking Through?
Yes, I have the book, and I've read the book.
Okay,
it's a really great book.
Okay.
I highly recommend everybody read it, and I also recommend everybody come to do the Zoom chat and to talk to you, because this has honestly just been so great, just being able to talk to you and say my symptoms and get a better idea of what's going on. Because for like I was diagnosed pretty recently, only 2006, 4 years, but for the most part, didn't really have any knowledge. And anytime I went to my urologist, her course of action was, let's shove drugs up your bladder, and she didn't really want to sit down and discuss with me what I was doing or do any examination. So
see, and that ultimately is what he talks about in the book. He talks about how doctors stay in their box. They're uncomfortable going outside of their box. Bladder, urologists focus on the bladder. It's just trying to get a proper diagnostic workup. It's really challenging. I mean, and God forbid they never receive the training anyway, right? I mean, medical school, it was, I'm going to say it was like in the year 2000 that the first physical therapist attended a major IC conference to educate doctors. It is still not normal course work in medical schools. The whole relation for urologists and going through their residency, are they trained in how the muscles influence the bladder? Not so much. I know Ken Peters said to me, he said, when I go out and teach other doctors about IC and the muscles, he says, I blow their mind. They had no concept of the role that the muscles play in their symptoms. And the gratitude that those doctors usually have in saying, thank you for helping me understand why I have a patient who's non-resistant or who is resistant to traditional therapies. It's just another line to explore. So, all right, hon. Well, listen, you look great. You sound good. You've done your homework. You've went and you've asked people specific questions, and you're asking them to study your body. Power to you.
Yeah.
Now we got to get the muscles checked out. Okay?
Yeah. I honestly feel like I'm finally on the right track. I just, got to get the appointment for the pelvic floor assessment. So
right now, I
see my primary soon, so maybe I'll ask him, because he seems more open to getting me the tests that I'd want to get.
Right. Anne on Facebook is saying, what's the book? The book is called Breaking Through Chronic Pelvic Pain, A Holistic Approach to Treatment by Dr. Jerome Weiss. Best book ever written by far. The irony is I'm still editing another new book on IC. And when this book came out, we actually held the other project up because this book is so good. All right. Okay, hon. Keep us posted, and make sure when you go to the physical therapist, you outline your athletic history and any injuries you had, okay?
Okay. Yep. Thank you.
Okay, hon. Talk to you later.
Yep.
All right. Julie Ann, how are you today? Hold on. Okay, you are now unmuted.
I'm good. I have been dealing with bladder spasms since Wednesday.
Oh no. What do you think happened?
I think a lot of it has to do with my new job. I'm working from home, so I'm working 8 hours a day sitting down.
Okay.
So I think a lot of it has to do with my new job.
Why do you think it's bladder spasms as compared to pelvic floor spasms?
The medication that I was taking for like the pain didn't help it. And I actually took one day off from work, and I took half a day on Friday because I couldn't deal with the pain anymore.
Okay, but you're not so okay now. So you didn't quite answer my question, and this is
the urinary frequency pains.
okay, but that doesn't differentiate between the two, right? So a bladder spasm is a very usually, now anybody out here, especially on YouTube and Facebook, feel free to add your feedback. I have personally found bladder spasms to be very violent. Like as the last couple of drops are coming out of your urethra, you like literally bend over in pain, and you're holding this position literally for a couple of minutes as the spasm shoots up your spine and down your legs. It's just like involves your whole body. So does your spasm happen as you're urinating? When does it happen?
It happens as I'm urinating, and like my pain doesn't go away like it usually does for other people once they go to the bathroom. My pain doesn't go away anymore.
What does it feel like? Try to describe it.
Feels like somebody's pouring alcohol into an open wound.
Have you done a UTI test kit?
I have, and I also have the azo test strips that I keep on hand, and it came back negative.
Was it negative for both leukocytes and nitrites, or just negative for nitrates and positive for leukocytes?
It was negative for both.
What makes the pain better?
A heating pad.
Okay, so what does heat do? Heat relaxes muscles.
Mm-hmm.
I'm still not convinced you're having bladder spasms. When you think about, I totally, number one, I totally believe you. You know, there's no hesitation. I totally get that you're struggling. But sitting for 8 hours shouldn't cause a bladder spasm. Sitting for 8 hours would cause a pelvic floor spasm. Where is it located? Where's the pain located?
My pelvic bone is hurting. My back is hurting. My bladder is really bad.
Which pelvic bone is hurting? Front, or is it pain in the front area, or is it on your sit bones in the back of your butt?
It's in the front area.
Oops, just dropped my vulva again. That's gonna be my new thing. Do you have pain anywhere else? Is pain shooting down your legs?
No.
Do you have superficial pain on your skin?
Mm-mm.
Do you feel pins and needles anywhere on your vulva?
No.
Do you have any rectal pain? Do you feel a vibration, a sense of vibration?
Yes.
Okay, that's pelvic floor. Where is the vibration?
Okay.
I mean, that's usually where is the vibration?
It's usually like in the very front of my pelvic bone.
You guys, now listen, y'all, we're a public support group. Anybody can be watching this and the recording. I don't want to ask anything that would embarrass anybody. And so I want to ask you a question. Do you have any PGAD symptoms at all?
Mm-mm.
So I guess the only way to really test this theory is heat is relaxing muscle. So would be what would turn it off. Would a smooth muscle relaxant turn it off like ditropan? Or would a skeletal muscle turn it off like baclofen or Flexeril or Valium? So have you been working with your urologist yet about this flare? Do they know you're having this flare?
I'm still working on trying to get my new health insurance for my job settled down because they mixed up my birthday completely. So I have no health insurance right now.
Oh, it sucks eggs. Are there any women? Is there any clinics you can go to? Granted, would we want to go to a clinic?
I tried going to like an urgent care the other day and they wanted like $400 out of pocket.
Okay. Well, now listen, I'm not a doctor and I cannot be giving you medical advice. Everybody, y'all need to understand that. I'm an educator here. We have an open question here, and that is this a smooth muscle spasm or a skeletal muscle spasm? I think until you have access to a doctor, you've got to do anything you can to relax muscle. So you're just going to have to do both. You're going to, so with your job, you need to get up and walk around every 15 minutes. And that's the cool thing about working from home is you can do that, right? You can do that. They aren't going to know. And you can even you have a sit-stand desk. Joe says, should I stop Elmeron? Joe, I will come back to that. We're doing the Zoom meeting right now, but if you stick around, we'll come back and ask that question. Okay, so make sure you're getting up, moving around. Make sure you're doing some stretches before, it's important to kind of just loosen up, right? When you're doing and trying to stretch out the back of your legs before you start to work out. And, I can't show it right here. It's in our magazine, some of the basic relaxation things. Try not to start work without a little stretch out first. Try to walk around a bit out of your house, do a little laps. My thing, what I do is I've got a great headset or my cell phone, and whenever I'm on the phone, I'm up and walking. I'm rarely ever sitting here. I am always up and moving around because it's just hard to sit for a longer period of time. You also need to protect your bladder because we don't know if it's smooth muscle or skeletal muscle. So make sure you're following the diet, drinking water. Chamomile herbal tea, peppermint herbal tea are both smooth muscle relaxants. So I think trying a little bit of chamomile tea during the day might be helpful because that's proven in research studies to calm the bowel. And if it will calm the smooth muscle of the bowel, it should help to calm the smooth muscle of the bladder. So I think for drinks, that's what I would be doing. Does Azo bladder pain relief tablets, do you feel better when you use something that will numb your bladder? Does it take any of the spasm away?
I do feel better when I take the Azo tablets.
Okay.
But I realize that the more I take them, the less it's starting to work. I've been taking them for too long already.
What do you mean? How long have you been taking them?
I've been taking them. Well, I've been using Azo since before I was even diagnosed with IC.
Okay.
And then I've been taking them more often now because of my bladder issues and having to work and not having health insurance yet.
So Jody over on Facebook said, she talks about something that's fairly well known, is that for some people, you can use a sterile glove and put some water in it and then freeze it and then potentially use that to reduce some vaginal burning or vaginal discomfort. Are you having any vaginal symptoms at all?
Yeah.
Well, what vaginal symptoms are you having?
Like I can still feel the burning even after I use the restroom.
In your vagina?
Mm-hmm.
Oh. Well, a muscle that's working hard is a muscle that builds up lactic acid, and that muscle will burn. It has a burning sensation to it. So you are in a pickle, and I'm sending you a big giant hug right now. Big, big, big giant hug. Let's look at the good things here. Let's look at what you got going for you right now. What you got going for you is you can work from home. What you got going for you is you can pay whenever you need to. What you've got going for you is you can use a heating pad whenever you need to. What you've got going for you is health insurance sooner rather than later. And so what I want you to do is I want you to focus on that right now, because you have everything you need at your hands to at least get you through this more intense flare until you can find a doctor who might be able to prescribe you one or other to try to help figure out the type of spasms you're having. I mean, the fact that you're having vaginal, I just don't know. And I don't think you know either. I think we're guessing. So we need some facts now. So, but you've got resources right now. And hopefully this week they'll get it fixed out and you can just make a phone call. Sound good?
Okay.
What are you drinking?
Yeah.
Just tell me, what are you drinking during the day?
Water.
Anything else?
That's all I drink is water.
Do you take a multivitamin?
I take a probiotic. Once a day probiotic.
Is there anything else in that probiotic? Are you sure? Make sure you look at the label and make sure, because sometimes when we see, bladder spasms are really kind of when that bladder starts to quiver, like it's vibrating, it's quivering, is a sign of a massively, massively irritated bladder wall or a really active infection. And so when we look at that intense daily bladder pain, we always look at, is there something in your daily life that is provoking that pain? And so a Brita water filter, do you drink water out of a water filter that could be producing more acid water? Or are you taking a multivitamin? Or is there something else that's really, really provocative here to your bladder? Also, too, what's the quality of what water are you drinking? Is it tap water? Is it bottled water?
Yeah, it's tap water.
And what state do you live in?
Florida.
Okay. Okay. Is it good water?
Yeah.
Okay. I mean, it might be interesting. I like some states have absolutely terrible water. I was working with a lady in West Virginia. Oh God, their water was so bad. It's unbelievable. She couldn't drink it at all. And they had COVID and she had to order water from Amazon. So, I mean, I would look at the quality of your water, maybe call your water department, take a look at testing results, see if there's anything funky going on with your water. But, let's wait and get the health insurance and get a doctor to look at you. Okay.
Okay.
Okay, hon. I'm so sorry.
Thank you.
But again, you do anything you can that will keep you relaxed and keep your muscles relaxed and go for that heat. And this is where something, that would have a pain fighting effect. It would be nice if you had a little bit of pain medicine or, to try to get you through it. So push tomorrow and see if you can get more info on your health insurance. Okay.
Yes.
All right, hon. Nice talking with you.
You too. Bye.
Bye-bye. Okay. Hold on one sec. Let's go to Linda. Hello, Linda. How are you, hon?
Good afternoon, Jeff.
How is life today for you?
I don't know why I'm so fatigued. I got up this morning and watched a church service, and then afterwards I laid down again. But my pain-wise with the IC, I wanted to ask you, for the last year and a half, I've had a hydrodistension with Kenalog injections that have lasted me about 3 months.
Okay.
But they had to be 4 months apart. And the last one that I had in May, I didn't get any pain relief from it. So I've had to relearn all the strategies from all the time that I've had it prior,
Mm-hmm.
as far as the heating pad and the Uralgesic Blue is my go-to for pain.
Okay.
And I try to minimize when I use that. I did start physical therapy for pelvic floor this past week.
Okay. What they find when you did the PT? What'd she find?
Well, I've had PT. She's the fourth one over the years, and the trigger spots that she touched were, I told her, 7 o'clock on the left side is usually where I have most of the pain. She recommended me to be using the dilator, which I haven't used for probably a couple years.
Okay.
She wants me to bring it in next time I go in.
So what she's saying is that your pain. So we've got noon, 6 o'clock, and she's saying your pain is at 7 o'clock.
Well, that's where I told her is on me. It's on my left side.
Okay, and
Up center.
Okay, and what did she say then?
That she could feel irritation, or I don't know if she said a knot, because whenever the physical therapist had put pressure on the trigger point, the pain subsides.
Okay,
And
so that's great news. I mean, that's really, really, really great news, right? Because they found a knot, they found its dysfunctional spot in the muscle, and when they work on it, they release it, the pain goes away, correct?
Yeah.
Okay. So that's really exciting, because that helps us understand that your muscles are clearly a part of your problem, if not the dominant part of the problem. The challenge here is that you are in the chicken versus the egg dilemma. Both your bladder is involved and your pelvic floor is involved. And our job here is to try to figure out which one is driving which one. Is it a viscerosomatic reflex or a somatovisceral reflex? Is the bladder itself in so much pain that it's forcing your muscles tight, or are your muscles injured and dysfunctional, and that's then messing with your bladder? That ultimately is the question. Did the physical therapist find any other interesting dysfunction?
When she was checking my abdomen, she said that there was some, I don't know if she used the word hard, or pressing against, like, the I love you, to do the exercise where you give pressure vertically, up ascending, colon, and then across the transverse, and then down the other way.
Okay.
Like the letter U, I love you.
Okay.
She was having me do that, which I've been doing the last few mornings.
Okay.
That some of the tissue felt stiff to her in the process of pushing the fascia around.
Okay. Didn't we talk about fascia last week?
I didn't attend last week. It's been 2 weeks ago. When I first watched one of your shows, maybe a month ago now, something was mentioned about other muscles being involved. And I have been in physical therapy for my left hip for the last 2 months.
Okay.
And having watched your show, somebody said there might have been a correlation between the pain in my left hip and my bladder.
Right.
Or, I mean, when she's doing the physical exam, it's in my vagina. I did go to a sports doctor 2 weeks ago, and I have I don't know if I can say it right, trochanteric bursa. So the bursa that's on my left hip is what has been inflamed, and the physical therapy has been helping.
Okay.
My hip still hurts to some extent, but I wanted to find out if there was, because my bladder pain is mostly on the left side, and my hip pain, that if if the hip on my pain is from 5 years ago. I was
Well, no,
diagnosed
I mean, listen,
12 years ago with IC.
yeah, but I was just talking earlier about a new research study that found that men with testicular pain, a significant percentage of men with the testicular pain had an underlying hip abnormality. And so that's exactly what Dr. Weiss talks about in his book, that there's a mechanical dysfunction with the way bones are relating to muscles relating to organs. And so if you have a bad hip, that is stressing your pelvic floor muscles. And did you get the book? Did you get?
No.
Oh, girl, come on! You got to get. It's free on Kindle Unlimited if you have Kindle. But like, let me. Here you go. Look at that. I opened it right to a thing. So, I want you to let's see. I want you to look at this picture. So this is a picture that's actually demonstrating an ankle that's pronating, right? So here's an ankle that's rolling on inward. And I want you to look what happens as it goes up. And now here we are at the piriformis muscle. So the piriformis muscle on the bad side is stretched farther out than the piriformis muscle on the good side. Okay? And that's a source of long-term chronic tension in the piriformis muscle on the left side.
Now, one of the stretches that they have me do for my hip is stretching the piriformis.
Yeah, you have to, okay, everybody watching this, if you buy the book from the IC Network, if it is not helpful, I will buy that book back from you because I will give it to another patient who's low income. But Linda, girl, you have to get this book so that you understand how your hip is influencing your pelvic floor and how it's creating the foundation for all it. It could be creating the foundation for all of this. But the book is free on Kindle Unlimited. You don't need to pay for it. It's free on Kindle Unlimited. And guys, I am muting certain people because I can hear you while I'm talking to Linda. Okay, so this is your homework. This is your homework. You've got to understand the connection and the concept of a mechanical injury and how that creates long-term, constant chronic muscle tension. Okay? Now, listen, you mentioned that you're struggling with fatigue. Are you taking any medications like amitriptyline or Flexeril or anything or hydroxyzine?
No, in fact, as you mentioned that, the only medication, in fact, that would make me drowsy is I take an antihistamine every day for two reasons. One for allergies and the other one for the mast cells because it's helped over the years. But I've switched from Claritin to Zyrtec. The Claritin was drowsy, what do they call it? Non-drowsy. And the Zyrtec is not. So sometimes I reserve taking it unless I'm having a bad day. But I usually try to pay attention when I do take a Zyrtec because when it's an antihistamine that can make me drowsy, it makes me tired. Yeah, I didn't think about that.
But the number one side effect of Zyrtec is drowsiness. The number two side effect of Zyrtec is fatigue. Number three side effect, tired. Number four, dizziness, dry mouth, sore throat, cough, nausea. I can see that you're fatigued. I can see it on your face. I definitely can. So I suspect that the medicine might be messing with you, and I would encourage you to talk with the doctor about it. Okay. Mm-hmm. Just like all of us, we've all been there. You know, no shame, no blame here. You've done absolutely nothing wrong. You're doing what the doctors have told you to do. But when a side effect is interfering with your quality of life and it's making it difficult for you to function, you've got to tell your doctor because they may just need to reduce the dose. Okay?
I'm also seeing an acupuncture doctor.
I mean, acupuncture might be temporarily calm, but it's certainly not going to get to the root of the problem. You got a bad hip. We got to figure out what's wrong with your hip, what's wrong with your muscles. That's where you need to be spending your money, in my opinion. But that's just my opinion. If the acupuncture gives you comfort, power to you. But we got to understand the underlying anatomy here too. Okay. Okay, hon. Well, listen, keep us posted. Keep us posted, and you know, you've gotten good, valuable information here. You've got somebody working with you. That's great. But I don't. I think that the missing piece of your puzzle is you're just not. You're doing what everybody does, and that is you're keeping everything separate. Like I'm having bladder issues. Okay, I got the hip issue. I got this. I got that. You're not understanding the totality of how they're affecting each other. And that's what this book will teach you. And if you get the book and you have questions, I'd be happy to work with you and try to help you understand. Okay. All right, hon. Big giant hug to you. You are not alone, my friend. You are not alone. And I hope you and I listen. My left SI is just, I'm waiting for prolotherapy, but I can't do it right now because of COVID, because I have a bad ligament. The SI joint is, just to kind of give people, and I don't know if you can see it, the SI joint is this joint. It's a long joint that connects your hip bone to your sacrum. And it's about 2.5 inches long. You can see it right here from top to bottom. And it's a joint that's meant to be stiff. It's not supposed to move. So it's not locked into place, but it's held rigidly into place with muscles. And for some people, especially people who played racket sports, so look, I'm right-handed, right? And I would step in with my left foot, right? And then I would do this. And so I have all my weight on my left foot, and then I am rotating my weight in the right direction, which is a good tennis stroke. But unfortunately, it over time, it messes with the SI joint. And so my SI joint is very flimsy. It's very flexible. It's moving when it shouldn't be moving. And we just think that it's a ligament that it's just getting weaker and weaker and weaker. And my next step is prolotherapy, because it's a constant for me too. So you're not alone. All right, just let Linda in and somebody else in, or Donna in and somebody else in. All right, Linda, I have got to move on. Nice talking with you, hon. Keep me posted, okay?
All right.
All right, now. Andrea. So you guys, when you're ready to talk, put your camera on so I can see you, okay? Let me open the chat too. If you don't want to use your camera, that's fine. Just put something in the chat so I know when you're ready to talk. So Lisa said, if you have time to discuss it, I'm scheduled to have my InterStim replaced with an Axionics device on Tuesday. Any suggestions? Okay, so Lisa, here, hold on a sec. Andrea, hold on one sec. Lisa, can you?
That's not me. I'm a different Lisa.
Okay, Lisa S, are you there? Lisa S. Lisa S. Oh, there you are, Lisa. Okay. So Lisa, let's come back to that. Okay. So Andrea, how are you doing today?
Well, I have had about 5 months of no pain whatsoever.
Okay.
But yesterday, I just sat down on the couch and I had a shooting pain going straight up my vagina. It just the pain just came right back. So I ran for an ice pack.
Okay.
And sat down on that. But I realized that it was then gravitating towards the left side like it used to. So I went and got a hot water bottle.
Okay.
And I was up all night. Frequency, urgency, pressure, pain. I was bending over on the toilet. I was in just total agony all night long, and didn't sleep. So you see me yawning. That's just from lack of sleep all night long.
Girl,
so
I am
it's
so
a little
sorry.
calm today.
Okay.
It's a little calm today, but I just do not know. And last week my skin on my right hip was so tender, I couldn't touch it. I thought I was going to get shingles or something, but it never came. Then I started to get this terrible back pain on my right side, and my buttock coming up my back. And I just didn't know what was going on. I thought I was going to get shingles, but nothing.
So, and was the pain you got when you sat down last night on the same side?
No, that came right up through my vagina. That was like a piece of glass that was just shoved right up inside. And then I felt like if somebody's fist was pulling everything out.
Okay,
so I got everything all at once.
Okay, so I've had that exact feeling. I still get that every now and then. That's a levator ani muscle spasm. And the fact that you have had a short-term history of musculoskeletal issues going on, and along with skin sensitivity, which suggests that you might have muscles so tight that they are squeezing nerves, right? Dr. Weiss in his book talks about how he looks at, here, hold on a sec. I'm just muting people. Dr. Weiss talks about how he believes that a lot more people have nerve injuries than they realize. And the way he assesses that is by looking at the skin and looking for pins and needles, looking for abnormality, looking for anything at all like that. And then also evaluating subcutaneous tissue, which is the tissue underneath the skin, for sensitivity. So,
well, that sensitivity has gone.
Okay.
That lasted for a week and that disappeared.
Okay.
And then the dreaded yesterday came, and I just eventually, what I thought, to be quite honest, I realized yesterday did not go to the toilet. I did not have a bowel movement. And I thought, wait, maybe I'm constipated. So I took some bicarbonate of soda last night, and I did have a bowel movement, and I seem to be back to somewhere normal. And I still have the frequency, not urgency, frequency. So I was wondering if something is resting on a nerve.
Sure.
But that just took me right to hell. I just like, oh my God, how did I get here so fast?
Well, I mean, but see, you gave yourself your own clue. You sat down and you got the pain. Movement drove the pain. The act of going from standing to sitting pushed the pain, which meant that when you sat down, you compressed something, quite possibly, which means you either, and the fact that you've had some shooting pain focuses on that. Remember, when we look at positional pain, we're kind of going from standing to sitting, but you have to throw that in with the fact that you've got a fist up your vagina pulling downwards, which I had for 10 months after my hysterectomy, and I still get one. I had it this morning again, a little bit. And that's a muscle spasm. What were you doing yesterday before you sat down? Were you working? Were you out in your garden? Were you shopping? Were you cleaning house? Were you running? What was happening?
Well, I was just doing odd bits and pieces in the house, nothing heavy. But a week prior, I was in the garden pulling plant pots around. And I got a little bit of back pain and I stopped.
Okay. And it was a week ago that you started having that pain on your skin.
Yes. It's that sensitivity, so sensitive.
Right.
So I can't even think of, but I had no pain for about 5 months. So to be quite honest with you, I didn't want to, I just thought, oh my God, maybe it's gone. But I've also I know I have the estrogen atrophy. I know it.
Yeah, but this isn't, I mean, listen, if you had an incredibly dry vulva, I mean, listen, we know dryness happens and it just gets progressively worse until we can make a case for the fact that finally your vagina got so dry that when you sat down that last time, that is what triggered the pain. But that doesn't explain the pulling sensation. The pulling
Okay,
sensation is
right,
a muscle sensation. The
Okay.
pins and needles on your skin, that's a nerve sensation. So I think,
right,
and the reality is that you're not having bladder. It didn't start with bladder symptoms. It started with muscle-driven symptoms, and the bladder was secondary. So you really are kind of the perfect example of muscles triggering other issues. So
okay,
I think you should call your doctor and tell them what's happening, and tell them that when you sat down, this happened. But you need to tell them that you have a pulling sensation. Do you still have that today?
no,
Okay,
no,
good. So the
thank God.
spasm release. Have you worked with a pelvic floor physical therapist at all?
I went once prior to COVID, pre-COVID.
Okay.
So,
And what did
she
they
did,
find? What did they find?
she did say that there was some tightness,
Okay.
and I was doing some yoga and so on, and I mean, everything's, I had no pain whatsoever. Yes, I got up 4 times in the night, and I was just so grateful there was no pain.
Yeah.
I can live with that. The pain is just, it was just like terrible.
Okay.
Alien trying to crawl out of my body or
Oh,
something.
girl. Hey,
Yeah.
I had this for months, and I was crying and emailing my
Yeah.
doctor. There is a fist up my vagina, grabbing onto whatever I can and trying to rip it out of my body. That is a
Yeah.
classic pelvic floor thing. So I think that it would be important to do things that might help relax your muscles while you're waiting to get some feedback from your doctor, and see if there's anything else that could be going on. Okay.
Thank you.
Okay, hon. Well, you're absolutely not alone there. And guys, let's take a bio break really quick. I need to go to the restroom. Everybody, go get your water, go use the restroom, and we will be back. Okay. Oh, I'm stiff too.
Hi, guys. Hi, Andrea. Hi, Patty. Hi,
Hi, Donna.
babies. How are you? How are you? Yes. Hi, Linda. Hi, Lisa. Hi, April. Hi, Susan. Hi, Lisa. My IC family. Mwah. She went to the bathroom, guys. You know that.
Give me 1 sec. I'm gonna go blend up some ice.
Uh-oh.
I'm really hot.
So, Donna, do you just drink water? What do you drink?
I do. I go between, I know you're not supposed to, what do I want to say? I drink spring water, and I also drink, what it is, but it's the pH water, that you shouldn't drink all the time.
Alkaline?
Back and forth between the two. Yeah, I do.
Chamomile tea.
I've never tried that before. Is that something that
It has no problem for me. I was chamomile and water only, nothing else.
Nothing else. Okay.
Fine, I have no problems.
Yeah. Now I drink ginger and chamomile. My bladder can. Yeah. I have vulvodynia, and I find that the ginger is. Yeah.
Okay.
Well,
I was drinking peppermint. No, I shouldn't say that, but heartburn. And when I was looking up to see, it's drinking peppermint tea, 4 cups of tea every day. So I thought I'd ease that and try chamomile, but never had heartburn so badly. But maybe it was also.
Yes. And it's trial and error, Andrea. I find, and I'm going to say this to all of you, sometimes another thing creeps up and you think, oh my God, what the hell is that all about? You know what I mean? I mean, it's like, okay, and yet the vulvodynia came about. And then I had nerve pain, and then the leg after another, and I think, oh my gosh, you know, what absolutely, absolutely. And I think it's like, are all these, you know, we talk about all these things being, read that book that Jill has, which I do have, and you start thinking to I start thinking, wait a minute, this makes sense. If you think about it in that terms. Now, if you don't think about it in terms of things to you, but if you really do think about all these things that are abuse we've done to our bodies over the years, and then as we get older, especially as women, if there are any men in here, I apologize to you. It's not that you don't. For the women, the things that we do all of our lives that really connect us to the fact that what have we done to ourselves? And then we come to a certain point and we go, whoa, oh my God. And then one thing happens to another. And then we so-called, quote unquote, get diagnosed with IC, and then we meet someone like Jill, and then we start thinking about all these things, and then it's interconnected, and then you start going, oh my God, what have we done? Not that we blame ourselves, because like Bill said, there's no blame, there's no shame. That's not what I'm talking about. I'm talking about just thinking about how we treat ourselves. And that we have to be more kind to ourselves. And if we're more kind to ourselves and we're interconnected to ourselves, we really connect to ourselves, we can find some of those solutions that we sometimes think that doctors should find. And don't get me wrong, I've been in serious pain. I've been in so much pain that I didn't even know what to do with myself. Okay. I'm not discounting that. But what I am saying is that, however, I shouldn't say but, however, I've learned over the time that I've been diagnosed with quote unquote IC or pelvic pain syndrome or bladder pain syndrome, that connecting to who we are, really stopping to learn our bodies, like Jill has said, you have to really connect. Sometimes we don't even connect. We are so disconnected sometimes as to who we are. When we then we start thinking, and Jill starts asking, have you had this concern? Has this gone on? And you start saying, well, yeah, that happened. Because we don't give ourselves the time and the energy to connect to who we are. So when Jill says, well, have you had this go on? And you go, wait a minute. Yeah. And she says, well, what about this? And then she starts going over the different parts of and she starts going over everything, and you start going, wait a minute.
You know what? But you know
start
what?
saying to yourself, whoa. And I think that's what it's really all about. Not totally, but it's reconnecting to who we are as
it's about
men. I love you out there. You're wonderful. But women, we really need to connect to who we are, because having children, having a hysterectomy, which I've had, having all those things that go on, making love, riding bikes, like Jill says, gymnastics, sports, all those things that we've done over the years has really been abusive. And now with that umbrella, we see so-called IC under that IC umbrella, but it's expanded more than that. It is pelvic floor, it is bladder pain, it is vulvodynia. It's all those things.
Okay,
and I've had them.
But
I'm telling you, holy cow, holy moly, I tell you, if it hasn't been for my sister Jill, I don't just say this to promote her, and you guys who know me know that I'm not saying that. What I'm saying is that having her continue week after week to reinforce the things that we have to take the responsibility to understand and connect with is so important.
Okay, but Donna, wait, but Donna, the other piece that's missing here,
yes, ma'am,
is trusting yourself.
And absolutely,
believing in yourself and believing in your intuition. There are so many women out there who they go, it happened after this happened. It pain when I sat down and it shot up my vagina. Right? That is exactly when it happened. And yet and this is true for men too. You have to remember that doctors are taught to diagnose by observation. They cannot see any of this happening. And so what they're doing is they're evaluating your symptoms, and they're evaluating your tone of voice, and they're evaluating your level of whatever you're promoting out, including the anxiety and all that sort of stuff. And that's why I want everybody to be able to walk in calm, informed, educated, and ready to engage in a peer-to-peer conversation with another human being. And if that doctor has the audacity to say, woman, I don't believe you, or man, I don't believe you, you stand up, you shake their hand, say, thank you, sir, or ma'am, I deserve better, and you walk and you go somewhere else. We do not deserve to be minimized. We do not deserve to be disrespected, and for any sort of reason. But I think in the end, you're right. It's about, it's not just about understanding the toll of life and the specific issues that women go through, that men go through, very similar issues. It's about valuing your, it's about valuing yourself, and it's about not giving up your power. You pay them.
Thank you. Yes.
They don't pay you. When you go to a doctor, you're going for their expertise in understanding your anatomy, period. And that's why, Dr. Brookoff, in one of his lectures, he said, he made something, oh God, what was it? It was so good. It was about morality. Said anybody who makes pain a moral issue, you need to walk away from. This has nothing to do with morality. This is about bones and muscles and organs, period. End of story. So, all right, well, let's.
And you know what? And Jill, if you don't mind me interjecting, when Jill says, I want you to go in there and I want you to feel empowered, and I want you to go in there and I want you to talk about the specifics of your pain. I remember, and I don't want to take up any more of your time, because I've dealt with this, and so I have so much more to learn. I know I do, but I've dealt with this. But I remember going into my urologist's office. I was in a wheelchair, and I'm telling you, I was in so much pain. I didn't know what to do with myself, and yet I had all my books and I had my literature. I had everything with me, and I was going through it, and the pain was so excruciating. I didn't know what to do. But when Jill says you have to go in, it's almost like you have to put that on the back burner. Yeah. It's like you really do. And I mean, my husband was with me, but he was the one that was incensed, and I mean, he was just beside himself. And yet I was trying to hold my tears back and talk about my issue. Yes, was I ready to cry? You better believe I was. Was I in so much pain I couldn't even deal with myself? Yes, I was. However, I wanted that urologist to understand that you see me in that pain. However, I'm going to talk to you just like I would talk to anyone else. And if you can't come to me, if you can't meet me halfway, if you can't pick up what I'm putting down with what Jill says is that you go in there and you present your best self, then you know what? Later. And eventually I said to that urologist, see you later, because I was educated. I had my master's degree. I knew what the deal was. And so I went in there I was in excruciating pain. However, I was able to present myself, and he still didn't appreciate that. Then Jill was right. You say adios and you find someone else.
You move on.
So I'm telling you, ladies, you can do it. Yes. Is it hard? I feel like I want to cry right now. Yes, it is hard, but we have the strength to do exactly what we need to do. But we also, as Jill has said, and I believe that as women, we also should have the empowerment to say, you know what? Don't treat me that way. Are you kidding me? Okay. I deserve better. And you do deserve better. All of us deserve better.
Does. So guys, I am holding up, this is our free medical records kit you can download from our website. This is where you organize all of your information. So in our medical records kit, the first page is your medical care directory. It's just where your doctors are. Your second page is all of your tests that have been done. And you write down the results, the date of the test, who did the test, what the results of the test were. And I've got pages of tests here. I mean, I want every urine test ever done,
Yes.
recorded.
Yes.
I have your treatment history. What treatment have you tried? How long did you do it? Why did you stop it? What were the results?
It works. Yes.
Your pelvic floor physical therapy log. What did they find with your pelvic floor? Et cetera, et cetera. And anyway, so listen, this is free on our website. It's in our free download
Go
area.
there, ladies. Do it.
Do it. Just do it. And there's also every appointment. You have a physician appointment log. Photocopy this. Making notes for every single appointment you do. Put it in a binder so that you've got a binder you're carrying with you. Okay, Donna, I got to move on. Thank you, hun.
Go.
You are my
I love
sister.
you. I love you. I just wanted to be here for support for all of you ladies, because you know what? I love you, and I don't come on that often because I don't like to be out there. But you know what? When Jill starts talking and there's something that is just hits me at home, I just want you to know, it's like,
thank you.
Listen, because it makes it, she's not, I mean.
We got it. We got it.
Oh
thank
my
you,
God,
thank you.
Jill, you know.
Okay. Okay, I'm going to go to April. Thank you, Donna. April, you've been very patient, April. Hun.
Hi.
How are you today?
I'm okay. How are you?
I'm pretty good. I'm quite perky and energetic today. I don't know why.
Good.
But I am.
Yeah, me too.
Good.
Okay, so my question for you, I talked to you on the phone probably a couple months ago, and you're super helpful. I was telling you that I burn and have like a lot of pain, like in my urethra area.
Okay.
Really after I pee.
Okay.
So I'm like scared to go to the bathroom because it hurts so bad after. It feels just like it's pinching up there, just pinching.
How
it hurts.
Is it inside of your urethra or is it on the outside of your urethra?
It's hard to tell. I want to say it's more outside, like surface, but it's so painful that it is really hard to pinpoint where, and whether it's on the outside.
Is the pain only in your urethra or does it spread anywhere else?
It seems like it's really only my urethra.
Okay.
I tried. Mm-hmm.
Are you on birth control?
I am.
Okay. So, the urethra is the canary in the coal mine when it comes to estrogen atrophy. The bottom half of your urethra is a mucous membrane organ, just like your vulva. And it relies on estrogen to produce that nice thick coating of mucus. And when estrogen levels start to drop, the mucosal barrier starts to dry. And that means the urethra can't defend itself from the chemicals in your urine. So suspect number one is that is going to be some sort of hormonal issue.
And I thought that, just with my symptoms. Okay. And so I did go to my gyno, who I love. I could trust her. She did an exam and she didn't note like any dryness or anything. And then what else? Oh, and then my urologist put me on estrogen cream.
Okay.
I felt like, and I'm really sensitive, like to creams. Like, I was prescribed gabapentin topical, and it just burns a little. It almost feels like it's making it worse. And so I only tried the estrogen cream for like 5 days. I know it might take longer to like see maybe some results. I don't know what your opinion is on that, but.
So what we typically see in somebody with estrogen dryness is that it's going to burn when you first start using it, because your skin, it's, if you're as dry as you could be, I mean, clearly your urologist thought you might have been dry, gave you the estrogen. We would expect the estrogen to feel hot, because that heat is a direct reflection of the quality and health of your skin. But what happens is every subsequent time you use it, the heat should get better and better and better. And for me, it took about 2 weeks before I went from being super hot, like hot for 15 minutes, to a little tiny puff of air, just a little poof. That's how it feels like now when I use my estrogen. And for me, it always manifests in my urethra. I can absolutely tell when I haven't used my estrogen cream because my urethra starts getting that exact same thing. So 5 days is not
Okay.
enough for your body to incorporate that estrogen to start producing more mucus. It would be nice if you gave it a wee bit longer, maybe.
Yeah.
Yeah.
Okay. Just kind of like go through. Yeah. It makes my symptoms a bit worse, but maybe they'll get better after.
Well, what did
I
they
just
give
kinda
you?
go
Did they
over the
give you
hump.
Premarin or estrase?
It was compounded with
Okay.
testosterone too. She had a word for it. Maybe it was esterase. I don't know. So
So what was
yeah,
it? What was it? What was in it again?
testosterone, estrogen, and that's all I know.
Mm.
I don't know
Okay.
if there was anything else. Yeah.
Okay. Well, definitely let your doc, like, I don't use testosterone. I just use the estrogen, but obviously I'm much older than you are. And that might be a more appropriate, I don't know. I mean, it might be a more appropriate combination for you, for your age. I wish I were your age. I can't believe I'm getting
I'm
older.
33 and I've had this for probably the past 10 years.
Yeah. Yeah.
Off and on, but lately it's been just on. So I don't know if that, I guess I never thought it would be hormones because it did start so early on, like 20s. But anything is possible, I guess.
Well, but go back to your 20s. What were your first symptoms when you were in your 20s?
I had UTI. UTI symptoms went in. They were like, you have a little bacteria, but not a lot. We're just gonna put you on antibiotics anyway,
Okay.
And then I did get some relief. Like I took azo and that helped. It doesn't help. I have nothing that helps me anymore. But I just remember getting relief of, that route. And then
Oh wait, hold on. I hold on. Sorry. There you go. Say that
that's
again.
okay. What was I saying?
So you do the azo. The azo helps a little bit. You have the typical
It,
symptoms
I,
of a
it
UTI.
used to help. So now nothing will relieve my symptoms. Absolutely nothing. I've tried so many things.
So take us back in time to when your symptoms first started. What was happening then?
Nothing. There really isn't anything that I can like. There's not like a event that happened. I was in college and I just started getting bladder infections, which I don't think I ever actually had a bladder infection.
Were you an athlete?
No, absolutely not.
How about in
no.
high school? Were you an athlete in high school? Do you remember any falls?
And I've tried PT. I've done that probably for on and off for 6 months, but I really gave it. And she, I never had a trigger point. I never.
What did she say the health of your pelvic floor was? Was it tight?
She said it was a little tight, but it could be, the secondary symptom of something else, with the burning and for some reason, I think that I have an embedded infection. I don't know if that's something you even believe in.
Sure.
They know it's kind of, okay. It just seems like there's not a lot of people, like urology wise, that believe in those.
Well, and infection is real. It happens all the time. The question is it acute or chronic? And then if it's chronic and embedded, it's identifying it. The challenge that we have is that there's definitely a group of people who are saying that everybody has chronic bacterial infection, when in fact the research is absolutely finding fungal infections and viral infections. And so I just can't take blanket statements. That's what I say every time is I refuse to do an all or nothing. There's no doubt that some patients have muscle injuries, and I have no doubt that there's a small group of patients, not a big group, who probably do have embedded infections, chronic embedded infections. The question is identifying it. And so
I did the microgen.
Okay, and what did it find anything?
It did. It found the inner coccus. But that one, I forget the second word on that one. But was it just a very small amount?
Okay.
So I don't know if that's normal to have in some vaginas anyway, or some urinary tracts anyway, or if that's something to, if that's a sign that it might be an infection. I'm
Well,
not
but
sure.
but enterococcus is found in healthy people. It's supposed to be there. It's part of the
Yeah.
beneficial biome that we have. It's normally found in the bowel, but it can also be found in, in the rare pathogenic infection. I remember with Dr. Fukuzato, I was diagnosed with enterococcus. My whole family had enterococcus and micrococcus when we tested everybody, but we realized in hindsight that we were trying to treat a bacteria that is naturally present here anyway, and so. The good news is you don't have anything weird going on. You've got a fairly normal bacteria in there. It was a small amount. And so I don't know if we can.
I know it's hard because it's just, I don't know whether to go that route or not,
Well, I
because
mean,
I would have to be on long-term antibiotics. And obviously that's the last resort, but I'm almost there. I'm almost where I've tried everything, really, truly. Minus the estrogen cream, which I will definitely give
do you have
a couple months.
What about, so when your symptoms began in your 20s, had you just started birth control? Were you on birth control when that happened?
Yeah, I started when I was 15.
So there is definitely a small subset of patients who are very hormone driven. And we just had a case study of an 18-year-old who started birth control pills and 2 weeks later had all the symptoms of IC. And they diagnosed her with IC. They did a wide variety of therapies. Absolutely nothing worked. She got to the point where she was in extreme pain and severely disabled. Finally she went to many doctors. They diagnosed her with yeast. They diagnosed her with all sorts of stuff. Ultimately, in the end, it was a doctor who said, let's stop the birth control and see what that happens. And 2 weeks later, her symptoms were almost gone.
We
can't.
Something to consider.
Well, you cannot underestimate the role of hormones in the functioning of the urinary tract. They all come from something called the urogenital sinus. So when we were just a mixture of cells, little tiny cells in our mom's uterus, there was one cell that eventually diversified and created the urinary tract and the vulva and the vagina. And that is why they are all so estrogen dependent. They basically come from the original cell in the little tiny fetus. Do you even call it a fetus at that point in time when it's like 50 cells? I don't know. Okay, anyway, we cannot deny the role of hormones in these tissues. And so that would be another interesting experiment, would be, is your birth control messing with your hormones to the point that your bladder simply doesn't have enough estrogen, or your urethra doesn't have enough estrogen to be healthy? That would be.
So if you were me, should I get my hormones tested, or should I just try the estrogen cream, get off birth control, and see if my symptoms subside? Or do you think that it's warranted to test hormones?
Well, I think that they're all important pieces of data that will help you make better decisions in the future. So I think I would get my hormones level tested. But in the same sense, your doctor already gave you hormones. You do what a lot of women do. You stopped at 5 days. You can't do that. You're not giving them an opportunity to work. And so, so it may be that if you give that tissue a little bit of estrogen, it will plump up and produce mucus, and you'll be fine, and you might be able to continue your birth control. But it may be at your age, you shouldn't be having hormone issues. So the only thing you're doing that's restricting your hormones is your birth control. So that might be another interesting experiment to consider, is losing the birth control and seeing if that changes your symptoms.
Okay.
The good news here is that it's your urethra. No, but see, that's what makes you. So you don't have pain as your bladder fills with urine. You're afraid to pee because your urethra screams. Okay, that is not a bladder wall injury. That is not a bladder wall injury. That points us directly to the urethra, and we have to try to figure out and understand why that urethra is unhappy. And rule number 1 is moisture and estrogen. Whoops, hold on. So
even if I'm not dry, it still could be estrogen.
Yeah.
Or lack of.
Yeah.
Okay.
Could be. See, you still have ovaries. You're still producing some estrogen. Unlike me, I don't have ovaries. You can tell everything's falling. Okay, but you still have a baseline level of estrogen that I don't have. That's why my skin is getting drier and yours is not. You have enough to be basically moist, but the challenge here is that it might not be enough for your urethra to be healthy.
Okay.
So that would be, I think that based upon that case study that was just presented, and I went over it either last week or the week before, I think that makes a good argument for looking at your birth control. Okay.
Okay. Yeah, I will try those two things.
All right.
Fingers crossed.
And then also ask your doctor why they gave you estrogen and testosterone rather than just estrogen. I don't know. I mean, it's becoming more popular.
Well, so I said it was burning, and I went to another urologist because anyway, it's a very complicated, but the other urologist was like, well, testosterone can burn people. So like, I wonder if I should just ask for the estrogen then. So I don't know why she did that. I have no idea.
Well,
but I may
tell her you have
inquire
burning.
about that.
Yeah, tell her you have extra burning from it and you'd like to try a plain estrogen and see if that makes a difference.
Yeah. Okay, Jill, thank you so much.
Okay. Talk to
Bye.
you later. All right, let's see who's my next victim. You guys don't take it personally. I just go in on faces and who I've been seeing the longest, and okay. I never know who to pick. Okay, I'm going to go from right to left this time instead of left to right. So Leah, are you there? I'm trying to unmute you. It won't let me unmute you. Let me try. Okay, Leah is not there. So let's go to Susan. Susan, can you hear me?
Hi, Jill. Yes. Can you hear me?
I can. How are you, my dear? How is your day going?
Oh, thank you. Hi, Jill. Hi, everyone. I'm good. Thank you. How are you, Jill?
I'm pretty good. Pretty perky today.
Oh, very good. It's good to hear that. Well, actually, since I spoken to you last time, I went to see my general practitioner. So they did a urine test, and they sent the urine test in the lab. It came back normal.
Okay.
And then they've done, they checked my blood as well. They wanted to make sure my kidneys are functioning very well, my livers, and also to check my HB level. So everything came back normal.
Okay.
And
awesome.
So she said that she asked me about my symptoms. So I did say that I still have urgency and frequency. So she was like, since you saw a urologist in 2017 and the result in your scan shows that dilated urethra, which I was totally shocked with when she said this to me, because urologists in 2017, they never say this to me. They've never discussed this.
So what did
me.
she say to you? She said you had a dilated your urethra, or that she wanted to dilate your urethra. What did she say?
No. She said in the scan, when she looked at the scan, she said, well, she looked at the scan that was done in 2017 when I went to see urologist in 2017.
Okay.
So she said that scan shows that you had a dilated urethra. But I was quite shocked because urologists never discussed this with me in 2017. They've never said this about this to me.
Okay.
So that was something new for me when she said this to me. However, she said that she's going to refer me back to urologist.
Okay.
And
a dilated.
well,
that's interesting. A dilated urethra.
That was really interesting for me as well, because I have no idea about this, and no one speak to me about this, to be honest.
That's odd. I have to say that's a first. Are you sure you didn't misinterpret it and they were saying they dilated your urethra, or are they saying the examination showed that your urethra was enlarged and exposed? I mean, and
Well, I don't know because she was looking at the scan. She was looking at the scan that was done in 2017 because I explained this to you a few weeks ago as well. When I went, they've only they really did to me is they just did a CT scan and that's it. They did not do any cystoscopy, nothing else. So she looked at it and she was like, the results showed in the scan from 2017, it says that you've got a dilated urethra. And I was like, I don't know about this. No one said this to me about. So she said that she's gonna refer me back to urologist. So, and I'm sure in the UK it's not straightforward. So you have to wait for them to send a referral to actually a letter from the doctor will come and then you will go and see.
So sometimes what happens is if you're straining a lot, you could be creating you're putting kind of abnormal pressure on those tissues, which can then result in, what's the word I'm looking for? A pocket. There's a specific term for it, where you basically end up kind of either stretching out the tissue itself or it finds a weak spot in the tissue, which then forces that, God, how do I explain this? Let's just say this is your urethral wall, and let's just say there's a little tiny bump and a little tiny area of weak muscle. And as you push and push and push, it gets bigger and bigger and bigger. And you basically get an extra structure in there. But I don't know. I think you're going to have to go to the doctor and see what they have to say about that. I've never in 27 years had a patient say that their urethra was in an enlarged, dilated position.
Even the urologist back in 2017, they never said this to me. So that was maybe she didn't know what she was. And I asked her about the urine test, next generation urine test.
Yeah.
They don't know about this. They don't know anything about this.
You get to be the educator. You order it. And then they send you the kit and you just take the form to your doctor and have them sign it and say, listen, doc, I know you're not familiar with it, but my case is weird. And I would like to know if there's anything interesting growing in my urine. And this is, I'm going to pay for it. If you can just sign it so that we can look at the data, why not? It's just data. If it shows that nothing's wrong, then we're not going to be doing anything else with that. But at least it's a piece of this puzzle. But a bacterial infection wouldn't cause an enlarged urethra. I think that somebody's misinterpreting something. I mean, that just doesn't make.
I don't know. I knew that's going to be really interesting for you when I say this to you, when I mention it to you.
I mean, I'm just looking. I mean, it can be swollen, but that's not enlarged. Okay, well, you're going to have to ask more questions. That just makes no sense.
Yeah, so that's why I'm waiting for urologists to get their, appointment so I can go and see them and discuss this with them. Okay. And obviously, I want you to discuss about the next generation urine test with them as well. And I want them to do a new CT scan because that CT scan is quite old now.
But a CT scan is not diagnostic of IC.
Yeah,
it's not.
Maybe cystoscopy.
Well, yeah, at some point in time, you want somebody to look at the target organ. I mean, if you've been consistently having bladder pain over time, eventually you want somebody to look at it, right? And so, yeah, I wouldn't do the CT scan. I would be looking at the bladder and the pelvic floor.
Well, I'm actually against doing a biopsy. I'm happy for them to do a cystoscopy, but I don't want them to do biopsy.
Well, you're the boss. It's your body. They should respect your wishes, but you need to have a qualifier in there, and they need a qualifier.
I know when they because you know, I'm a nurse. I know when they take a tissue sample, they're taking quite a deep tissue sample.
Yes.
And my bladder is already injured, and I don't want extra, you know, inflammation in my bladder. And I know by the time I go and see them, my flare up is a bit better, because now when I spoken to you last time, I was flaring up really badly.
Mm-hmm.
So now I'm controlling my diets, you know, doing a lot of things. So now it's a bit better, and I'm sure by the time I go and see them, because it's going to take, in the UK, it's going to take at least 2 to 3 months to go and see urologists.
Right.
It's not, you know, it's not straightforward to just go and the next day go and see them. It depends how many people are on the list.
Right.
So, yeah.
Well, I mean, the good news is that you're better. The good news is whatever was going on has calmed down. The question is, we don't know what the trigger is. We don't know if it's your bladder wall. We don't know if it's your pelvic floor, correct?
Yeah.
Yeah. And so, you know, let's break down the symptoms a little bit more here, just to try to differentiate between bladder wall and pelvic floor. So bladder wall pain, you have pain as your bladder fills with urine that is relieved by urination. So if I were to ask you the question, when do you feel the worst? Before you pee, while you're peeing, or after you're done peeing? When do you feel the worst?
So when my bladder is full, obviously I get pain, pressure. I
Okay.
need to, you know, empty my bladder as soon as possible. So
Okay.
when I empty my bladder, after emptying my bladder, I feel a bit pain after that, and then it gets better.
Okay. So as your bladder gets fuller, you feel worse and worse and worse. You go to the bathroom. Yeah. Do you have pain while you're peeing or after you're done peeing?
After done peeing.
And how long does that pain last?
It doesn't last very long. Maybe a minute.
Okay.
Sometimes less than a minute.
Okay. Does the pain happen as the last couple of drops of urine are coming out, or is it like a minute or two after you're done?
Yeah. I mean, I find it really easy if my bladder is really full when I'm emptying it, that at that time I don't feel that much pain. If I have less urine to empty my bladder, then I feel more pain on it.
Because your urine would be more concentrated, and irritating, because that's just what happens. If water isn't important to dilute your urine, so it's not quite so caustic and irritating. So that makes sense that when you have less urine, potentially you might be a little bit dehydrated. Your urine might be a little bit more caustic and irritating, right? It sounds like it's your bladder wall with a bit of a bladder spasm happening, as you're urinating. So based upon that, I think having a look at your bladder wall would be, especially, how long has it been now? This has been going on?
4 years now, since 2016.
So the way we handle it here in the United States is that the way our guidelines are written is they don't want a hydrodistension done right away. Because their goal is to not traumatize the tissue. So they acknowledge in our guidelines that patients over the last several decades have been traumatized by their interactions with urologists, and that's why patients don't come back, is they have found testing and therapies to be quite painful. And so the IC guidelines that were released here in 2011 were created to address that. They specifically wanted to reduce trauma. They didn't want patients to suffer. And that's why they don't do high pressure, long duration hydrodistensions. In Europe, it's the exact opposite. In Europe, with the European Union guidelines, they want every patient to have a hydrodistension, and they want every patient to have a biopsy, because they use the pathology results to rate whatever process is happening. And so I don't know if the UK follows the ESSEC European guidelines. But I think that in the end, it's about trust and it's about clear communication, and it's about sitting down with your urologist and making it crystal clear. I don't know if you can say this in the United States. It would be something like, I will sue you at your ass if you puncture my bladder. I do not want you to do a biopsy unless you think you see cancer. If you think you see cancer, that's another story. You have my permission to biopsy it because I don't want to live with that fear. But if everything looks pretty good, I would prefer that you not cause any physical injury to my bladder. That means low pressure, short duration, and preferably no biopsy. I just don't know if you can get away with that in the UK or not. Can you talk to your doctors like that?
Well, of course, I think if we don't, consent for any treatment, they shouldn't do it. Otherwise, obviously, we're gonna sue them because they're not, they're going against our decision. Obviously, they will get sued, definitely. Yeah. So they will respect, patients' decision and choices. I would. Okay. Well, I will. Because I know what triggers my problem, Jill. Is
okay. What?
It's the food that I eat, acidic food, any sour foods, acidic foods, and when I'm sitting for a longer time. Whenever I'm in university, I know I'm sitting the whole day from 8 to 3:30 p.m.
Okay.
And especially 3 days of a week, 4 days of a week sitting in the chair, and I know my problem is coming back. So that trigger that brings my flare up.
Yeah, but you're not addressing the anatomy. So what you basically said is, I know that if I eat the wrong things, my bladder wall gets irritated. I know that if I sit for a long period of time, my pelvic floor gets irritated. That's basically, so it's important that you keep thinking about the structures, right? Because as a nurse, it's all about the structure. We got to understand the anatomy before we can do much else. So we don't know. You don't know. I don't know. We're guessing. We need more facts. The good news here is you have the next, that wasn't you. That was, you didn't have the next gen test, right? No. Okay. Well, you're still in the data gathering phase. I mean, I would want a pelvic floor assessment. It's been 4 years. Your bladder's not better. I would want somebody, but I'm not afraid of it because I'm very assertive, number one. And number two, I trust my doctors. I mean, I just look them in the eye and say, this is what I want. Are you going to do this or not? And if they say no, I'm out the door. And so I would want somebody to look at my bladder if this had been going on for 4 years. You're diet intolerant. You could be having bladder spasms, but you're also having pain when you're sitting. So bladder wall, pelvic floor. Have you had, and so have you been to a physical therapist at all?
No.
Okay, well, it's time. It's time. It's way too soon to talk about therapies. We don't know what the right therapy would be for you or what your therapeutic options are right now because we don't understand your anatomy. We got to understand your anatomy first. That's the problem. We don't know your anatomy right now, and you don't know your anatomy. So you've been guessing for 4 years. It's time to stop guessing. Let's go ask some hard questions and let them do a pelvic floor exam and see what's going on, and maybe look at your bladder if they're willing to meet your terms and see if there's anything funky going on there. So it's been 4 years. So what was happening 4 years ago? What do you think triggered your symptoms? I mean, what the very first time you had symptoms, what do you think triggered it?
Well, actually, as I explained last time, it was about vaccines that I got, flu vaccines, when I was first year student nurse. They gave me these vaccines. I had that vaccines. After that, I had a really bad cold that I've never experienced that cold in my life. And then I went to sleep, and in the middle of the night, I waked up. The pain in my back was unbearable pain in my back. And then in the morning, I waked up, I was shivering, I had temperature. I went to my general practitioners. They did a urine test and they were telling me, oh, you've got kidney infection. So they gave me antibiotics for kidney infection for, I think it was for 7 days. And after that, the burning did not go away. After that 7 day, I went back to them and I said, I had the antibiotics. However, the burning is still there. They gave me another course of antibiotics and they sent my urine again to the lab. It came back normal. And I said, no, I still got my burning. And that was the time they sent me to urologist. Just said to me, explained to me the symptoms. So I said, all I have is urgency of frequency. I cannot eat acidic food. So they said to me, oh, this could be IC. They did a CT scan. CT scan is normal. There's nothing in the CT scan. And they diagnosed me, the doctor diagnosed me, actually said this could be IC. However, the treatment that we're doing currently is not responding very well. We're not getting really good results. This is back in 2016. So he said to me, we're not getting really good results. So I really recommend you to first try your diet, control your diet.
Okay.
And then that's how it started.
Are you on any sort of anti-cholesterol drugs known as statin drugs? Have you ever taken anything like that? Well, and your kidneys are functionally correct?
Yeah, they did a blood test. Blood test came back quite normal. Yeah, everything is normal. They said your kidney, liver, everything is normal.
So what's interesting here is I went to the National Library of Medicine and I found 4 cases who 12 days after having a flu vaccine developed kidney failure. But they were all taking statin medications. They were given steroids and they fully recovered.
I wasn't in any medication when I had that. It was a winter time, so they were giving it to all the staff in the hospital, and that was the first time I was getting that flu vaccine. And when I had that kidney infection, I basically had a really bad cold, and after that I had that kidney infection.
Well, we'd love to know 100%, and as much as we can, I mean, we can investigate it for years and years and years and still really never know what triggered it. The point is it got triggered. And so at this point in time, you have to focus on your anatomy. And ultimately, in the end, is your bladder wall healthy and are your pelvic floor muscles healthy? And we have to get you don't know, you're guessing. Everybody's guessing. You need facts now. You need the proper examinations. I don't understand a mechanism of action of how a flu vaccine would trigger any sort of bladder wall issue. I mean, I've had tons of flu vaccines myself, but everybody's different and there's all sorts of complicating factors, so that doesn't mean anything. Could the cold, were you taking any medications for the cold that you got? And you were on an antibiotic. What antibiotic? Do you remember what antibiotic you were on for the cold?
I didn't have any antibiotic for the cold, but I did have like a cephaloxine I was taking.
What is that?
Cephaloxine is for the kidney infection. Yeah.
Can you spell it? How do you spell it?
I think it was hold on, let me go to, it's CE.
Yeah.
Hold on. CEF, I think.
It's cephalosporin. Is that what it was? A cephalosporin?
No, it's cephaloxine. It's a CEFA.
Okay.
FALEXIN. Cephaloxine. I think it's this one, yeah. Pelvic C. It's actually it's antibiotics for the yeah.
Yeah,
for the
I
kidney.
just wanted to look at the side effects of that. Because, I mean, could it be
Because
that
this is the only one they gave me to treat my kidney infection, and after that, this burning did not go away. It stayed in my.
but did
you
the
know, in my
burnings
blood.
start after you started the antibiotic?
Yes. Because before that, I had no other symptoms. I did not have any symptoms. So they start treating me for kidney infection, and then after treating me for kidney infection, then I developed this burning.
Well, it certainly has a ton of side effects, including painful and difficult urination.
Oh my God.
It's known for causing, I mean, these are rare side effects, but they're still legitimate side effects. They are bloody, coughing up blood, bloody diarrhea, bloody urine, painful or difficult urination, pinpoint red spots on the skin, prolonged bleedings from cuts, unusual bleeding and bruising. Boy, if I were to guess, I would think that itching in the vagina, genital area, redness of the skin. Hold on a sec, decreased. It's known for triggering eosinophilia, and sometimes patients can have eosinophilic cystitis, which is an accumulation of white blood cells. So it's known for causing itching, yeast infection, vaginitis, vaginal discharge, renal, irreversible interstitial nephritis, renal dysfunction. Well, okay. It's time for somebody to look. I think it's time for somebody to look. I think that you can't let fear stop you from letting somebody just at least take a quick look at your bladder wall and see if they see anything funky going on. Your case is very unusual. You're the first person ever to report that their symptoms began after a flu vaccine. However, the antibiotic that you were taking at the time for the cold that happened is really well known to cause frequent and painful urination and bloody urine, which means it can irritate the bladder wall. So I don't think we can't say the vaccine caused it, because the antibiotic has a clear record of causing problems. The question is, why is it still persisting? Why has your bladder not healed at this point in time? And I think ultimately in the end, you're going to have to let somebody look at your bladder and look at your pelvic floor. You know, I would hate for you to waste another 4 years. If this is something that's really treatable, if they go, look, yeah, we can see it. You've got this little thing here. We can cauterize it, because the antibiotic's known for causing bruising. It's known for causing bleeding. Is there a chance it left a little lesion in there that is just continuing to not heal and is bleeding persistently? They could potentially cauterize it, inject it with a steroid, and nip it in the bud. But I mean, how long are you willing to endure this before you're willing to let them look?
Well, actually, I'm waiting for them to send me an appointment.
Okay.
Yeah, I'm waiting for urologist, because this time I'm going to different hospitals.
Okay, good.
I'm not going to the one that I went last time, because I did not have a good experience with them.
Okay.
I feel like they thought, like, what I really realized is, like, they don't bother to know more about you. And I just find it really, to be honest, useless, absolutely useless doctors.
Okay.
And some of them are new doctors, and these trainee doctors even more worse. And so many, 2 or 3 times that I went at that time, I saw it was just trainee doctors and they don't know much.
So this is how I would present it. I mean, I would walk in very head held high. You've done nothing wrong, no shame or blame, right? You're a nurse. You've got the creds. You have the ability, and the expertise and the experience to be able to discuss this. Although ironically, we know nurses are often treated poorly by other nurses once they're sick. Okay, you got to rise above it all. Walk in, no shame, no blame, ready to have a good discussion. And I think this is the way I would present it. I would say I had no history of any of this, any urinary tract issues until 4 years ago. 2 things happened 4 years ago. Number one, I had a flu vaccine that I appeared to have a really weird reaction to. And number 2, I ended up with a kidney infection and I was given an antibiotic known for causing urinary problems. And so I am baffled as to why I am continuing to have persisting urinary tract symptoms. And I would like you to help me understand what could be happening. And then I would like you to help me understand if my muscles are part of the problem, although I don't think they are, but let's see, you never know. But more importantly, what is the health and condition of my bladder wall? So as an example, if you were, we always talk about a series of cumulative injuries, cumulative traumas to the bladder. So let's just say that while you were in nursing school, or while you were in school in general, regardless, that you became a coffeeholic or you were drinking tons of soda, right? As we do when we're in college. We start because we're studying, especially if you're pre-med like you and I were, right? I mean, you're like studying all the time. There's no social life. You're studying, very little social life. And you're doing all-nighters. I mean, you're up until 4 or 5, I'm still up until 3 in the morning, ironically, 40 years later, which is ironic, still studying. But so could there have been an environmental issue that just kind of kept traumatizing your bladder over and over, a dietary issue where, you just didn't know you were traumatizing your bladder. You were doing what everybody else was doing, and you were just doing a lot of it, as we all did. So we can just say, okay, so based upon that, I understand that maybe my bladder just was a little beaten down by the acid. Maybe my bladder wall was a little bit vulnerable. And then, of course, happened to be on birth control, which would have dropped your estrogen levels a little bit more, which could have potentially made your bladder a little bit more vulnerable. And who knows, maybe for all we know, there's an environmental toxin or something that irritated you or something like that. So little event. And then the antibiotic was the straw that broke the camel's back. That was the one that pushed you over into dysfunction, pain and dysfunction. I mean, that's reasonable. That's reasonable. They talk about a series of traumatic injuries. And whether it's to the muscles or to the urinary tract, it sets the foundation for what could be a major problem later on. So I think that you are in a medical system that's going to make it hard. You are a medical system I've been there. The challenge with the United Kingdom, I flew there to speak with urologists as part of the urgent PC team. The problem with the UK is that there's basically 4 doctors who control everything in urology. They control everything. And if they're not on the side of IC, the doctors are not trained in IC. It is a very hierarchical system. And it's a very training limited system based upon what those top doctors think doctors should be trained in. So, you know, you are going to be an ambassador in a way. You're going to have to walk in with gifts. You're going to have to walk in with articles. I would actually just walk in with the book, Breaking Through Chronic Pelvic Pain, and give it to them. You know, gifts work. With my urologist, I brought gifts every single time. I mean, I believe in bribery, you know, I mean, but I gave them things that were clinically useful for them. I wanted them to understand that I knew how hard it was to work with me, and I wanted to make it easier. And so if you can just educate one person about, you know, about that antibiotic causing long-term chronic issues, you know, and in fact, as a matter of, hold on a sec, hold on a sec, wait a second here. Hold on. Let me just see if I can go into our federal database. And hold on, just hold on. Let's see if we can find a this is when, you know, here, let me share. I'm going to share my screen. Will it let me share my screen? Hold on, you're going to. Okay, so sorry, you're seeing all sorts of stuff here. Okay, y'all can see my screen, right? See all those crazy windows all over the place? Okay, now you can see the owl. All right, so the US FDA, it has very large databases that where we report information. And I was just curious to see if we could search it. I can search other databases. I don't know. I don't want to download a data set. I don't want to do that. I don't want to do that. I don't want to download it. I don't want to do that. I don't want to do that. I don't want to do that. You know what? It's here. See, it's called the FDA Adverse Event Reporting System. A simple search cannot be performed with these files by persons who are not familiar with the creation of relational databases. I am flipping them off right now. How the hell are we supposed to get the information? So we have got to extract the files. Darn it. Okay, so listen. Write this down, FAERS. I think you should learn how to use this database and search your medicine to see if they report any other issues. Because if they do, you can walk in and say, look, this is what it did to other people. This could be doing it for me too. Right? That would be and check the United Kingdom. Listen, you guys do some awesome research over there. Some of your research is absolutely amazing. See if there are any publicly identifiable databases in I don't know, do you guys have a drug regulatory organization? Like our Food and Drug Administration?
We do have like a, I don't know what you are using. We do have a BNF, and then we have a section where you can report any side effects of any drugs
Okay, but
that you take, and then you re-report it. Yeah, they have a section. They have separate section for any drugs that you're taking or you give it. You have to straight away report it to the company.
Okay, but the question is can you search that database?
We do have like a book, and we do have app as well. Yeah, we have an app for it.
Well, but you search the database of adverse events, not the PDR, but searching the database for adverse events. check it out and see. Okay. All right, hon. Well, listen, I don't know if I helped that much. I just think you've waited a long time. I don't want you to wait another 4 years. If this is a simple bladder thing, you need to give them an opportunity to at least check it out. Put your ground rules in. Say, I'm willing to have a cysto. I'm not willing to have you do a biopsy or anything like that. I just want you to look. It's a look. It's literally a 5-minute test. It shouldn't be that big of a deal. They numb your urethra, stick the scope in, take it out, you're done. That would be something to start with. And then if they said, yeah, we saw something weird, we'd like to maybe do a biopsy, ask them to do a picture. Ask them while they're doing the cysto, the plain cysto, if they can take a picture of what they see so that you can then see what they propose to biopsy.
Okay.
Okay?
Yeah, definitely. Yeah, I will. Yeah, thank you so much, Jill. I emailed you and I received the email back that the receiver reject the email.
Did you
I
send
emailed
it
it 2 weeks, was it 2 weeks ago? Yeah. And it came back to me and
sometimes
yeah.
that happens with Macs. The cloud that sorts the email will reject certain emails. So I have a couple of different email addresses. Let's see. You know what? I'm just going to put them in chat here. I'm putting them in the Zoom chat. There's one. Those are the two best ones to get me at. Okay. And
okay, yeah. So okay, yeah, just leave me the one that is the best. I've used the one, the IC network.
IC network at Mac.
That one. And it rejected my email. So it came back to me again.
Okay. Well, again, that just happened to my dad sending me something. It rejected his email too, and it gave a really weird thing. Then do the Jill at ic-network.com. That goes through a different server, and let's try that. And you can always message me through our website or through Facebook, or actually not Facebook.
Yeah.
Don't do Facebook. Do Twitter. Well, okay. Our website.
I was thinking to call you, but I was busy with my study, so I was waiting to, get a bit time and then call you as well. I actually ordered bladder bender and pre-relief from the website, IC website.
Okay.
And to be honest, the delivery cost me more than the.
It does. It does. That's
I think I paid in the beginning, I paid $56 only for the post. But when the post came here, it took quite time as well when I get it. I think it took me like 26 or 24 days to get here. And then they extra taxed me here. When the post came to UK, there was extra custom charge on it.
Yep. Yeah, there is. We can't do anything about it. Number one, right now, First Class International is dead. It's sitting in warehouses for months. So we and First Class is not trackable, and so we can't tell you where it is. So if we send it First Class Priority, our international priority, at least we have a tracking number, so we can kind of figure out where it is. And Priority is going to add $30 to it. And then if you do Express, it could add $100 to it, but it might get there in a week. But it's national politics and our postal.
Well, the good thing is I received it. I haven't tried it yet, so I was just waiting. Maybe I said I will try tomorrow and see how the bladder builder goes. And
well, just go slow. Don't take a full dose. Pill. See how you do. See how you feel.
Okay.
And if you flare with probiotics, then you might flare with bladder builder. So,
Okay, I'll test that.
Slow and
thank you so much, Jill. Thanks a lot for your time.
You're very welcome. Nice talking with you. All right. Right. Anne. Hello, Anne. Look at that beautiful picture behind you. Okay, I'm trying to unmute you. Okay, there we go.
There we go. Excuse me. Hi. How are you?
Hi, and you got some beautiful dream catchers there too.
Oh, yep.
Those are beautiful.
Thank you.
How are you doing today?
Actually, today's a pretty good day for once.
Yeah, baby.
Thank you. Yeah,
Okay.
yeah. Just a tiny bit of background. I have Ehlers-Danlos syndrome,
Okay.
and IC is a very common comorbid with it.
Yeah.
Almost everybody I know with Ehlers-Danlos syndrome has IC, including my daughter. So I was diagnosed 20 years ago, and after a series of installations, I did better actually for up until about 10 years ago, with just little interventions here and there.
Okay.
And slowly but surely, I've been having worsening symptoms.
Okay.
Until very recently, I've started having to see doctors here. Thought I've got a very good care from them, but I've started to get what I really thought were infections, very, very severe pain, worse than interstitial cystitis pain.
Okay.
And I would go to the ER, they would see my urine, they'd say, oh, this is severely infected, give me a shot of antibiotics, start me on antibiotics. Then the culture would grow out and they say, oh, there's nothing here.
Okay.
Stop the antibiotics.
Okay.
And then this has happened like 4 times. And recently I also had strep throat.
Okay.
And then it was really strange. I got that cleared up in about 4 weeks. Infection, and same routine. Oh yes, you have an infection. 3 days later, oh no, culture didn't grow anything out. And then I was just severe pain. Nothing helped it. Azo, nothing.
Do you have any blood? Do you have any blood in your urine?
I always have blood in my urine. Yep, I have for 10 years straight. I've had cystoscopies. Had one in 2017 that was clear. I just had the last culture they finally had told me they said was clear, except it had strep A.
Okay.
And then another culture had strep B. And then another culture again. This is driving me crazy. I keep getting what you say are not infections. I really feel they're infections. And this is always coming off as strep. And they're like, oh, this is something that's always in cultures. It's very often in cultures. It's not something we treat.
Right.
And then, ironically, it was time for my quarterly, whatever, cystoscopy, because I have had consistent blood in my urine. Also recently having red and white blood cells in my urine.
Okay.
Did the cystoscopy. I did it awake. I watched on the screen. My bladder was so infected. There was gobs of pus in it everywhere.
God.
It was disgusting. And then I had just had another test where they're telling me, nope, you're not infected. And here I was.
So
Severe infected. And again, and it grew out only strep. And then the doctor tells me, oh, well, for some people, it can be an infection.
Okay, so now listen, I am no expert Danlos in any way, shape, or form. So for people watching, Ehlers-Danlos is a group of inherited connective tissue disorders due to mutations of connection tissue genes, 9 of which have been identified. It is characterized by skin hyperelasticity, joint hypermobility, and connective tissue fragility. Fragile. The tissue becomes fragile. So I am looking at a research study from 2011, a case study of a man who he first thought was an infection actually turned out to be a rupture of his bladder It was the first published case of that. And I say this to you, I'm not saying that this is what you're dealing with, but I want you to, what we have to really ask ourselves is, how does Ehlers-Danlos affect the tissue of the bladder wall?
Mhm.
You know,
And just to be clear too, I do not have I have hypermobility type 3, but I do not have the stretchy skin. So it doesn't affect my skin. So I don't know if it's, that way with my tissues specifically. Just to give you some insight there.
so, I mean, our case highlights a potential urologic complication from patients with EDS. We postulate that the weakened bladder wall leaves them more susceptible to bladder overdistension and rupture when the bladder is placed under pressure. We suggest that patients with EDS showing evidence of bladder outlet obstruction should be managed closely. Care should be taken so that the bladder is not overdistended during cystoscopic procedures. And yeah.
That's interesting.
Well, I mean, you are in, oh, look at that. There's a cat. Somebody has a cat. I see an ear. I love it. I love it. I miss my baby so much. I think it's important that you not assume, like so many patients do, that when you have these symptoms of frequency, urgency, that it's infection, that you have a condition that is affecting your body in different ways. And I would really want to be diving into, hold on a sec. I'm just curious if there's a group. See, no, don't see. You itched your head, Donna. I itched my head. Did you see that? Oh, see, it's contagious. Now somebody else is doing it too. So the Ehlers-Danlos Society has, from 2018, let's just look at this real quick. So hold on, I'm going to share my screen again. All right. All right. Y'all see that big pink thing right there? All right. So this is Urogynecology and Ehlers-Danlos syndrome by Greater Baltimore Medical Center, August 2018. Voiding issues, frequency, urgency, incontinence, and neurogenic bladder. So let's just learn together here what this is saying. Okay, we know where these are located, so we don't need neurological supply of the bladder. Okay, got it. Evaluation of bladder issues, got that. Okay, not worried about that. Urodynamic, okay, not worried about that. Here are the voiding issues. Urinary hesitancy, slow stream, urinary frequency, bladder infections, kidney problems caused by inadequate detrusor contraction, inadequate urethral relaxation, high tone pelvic floor, and pelvic organ prolapse. So that's interesting. So it's talking about the smooth muscle of your bladder not contracting fully, perhaps leaving urine in your bladder, which could become a source of infection. It's saying that your urethra could be so abnormally relaxed that perhaps I don't know. High tone pelvic floor, okay, so let's look at this. Okay, that's a hell of a picture. Inadequate urethral sphincter relaxation. So if you're not able to relax the sphincter, they would have you do pelvic floor. Okay, that's just a creepy picture. Pelvic floor, I don't even know what the hell that picture is. What is that? Okay, weird. That is so weird. Okay, so medications, Cardura, Tamsulosin, self-catheterization. Then it goes to the high tone pelvic floor. Look at these beautiful pictures of the pelvic floor muscles. That bottom picture is awesome. Look at that picture. So it's saying if your muscles are tight, use a vaginal suppository. Again, going back to pelvic floor physical therapy. All right. For urinary frequency urgency, let's see what it says here. Treatment options. Okay, so here's the diet. Fluid management, no-brainer. Pelvic floor exercises, physical therapy, treatment, some anticholinergic medications, PTNS, which I've done myself. Okay, let's just see what they say about IC here for a moment. Initiating event, change in urothelial function, leaky urothelium, sensitization of nerves, presence of substance P. Oh man, hold on, I gotta copy that. That's a good picture. I want to be able to save that. Hold on. I don't know if you can see me doing that screenshot. Okay. It'd be nice if they actually said something about Ehlers-Danlos. Stress incontinence. Yeah. Sorry, guys. I don't mean to make you nauseous by me scrolling through these real quickly. Look at that great picture. That's a good picture. That's it. Well, that was not helpful. That was not helpful at all. I'm sorry. I wasted your time. Okay, well, obviously, patients with Ehlers-Danlos have urogenital issues. I guess the question is how is it affecting your sphincters, and is that why you're more prone to UTI? And given that circumstance, if they do think that you are, perhaps you could try something like Allura or a preventative.
Okay.
But you're certainly not, you are not a typical case of IC. You are living proof of the subtypes of IC because you are in your own unique subtype of Ehlers-Danlos syndrome. And I need to give Stacy an assignment to do an article on it. Hold on. All right, hon. I don't think I mean, it's just, the reality is you the preventive stuff for your bladders. We got to make sure your muscles are good. And in your case, you're going to have to be on it. You're going to have to be proactive, assertive with your diet, protect yourself. And you know, we know it works. We know if you follow the diet, your bladder will calm down. So stay on that diet. We know if you do the PT and relax those muscles, things should get better. Okay?
Yeah. All right. Thank you.
All right, hon. Nice talking with you.
You too. Thanks.
Okay. Lisa, have I done you yet, Lisa?
No, you haven't.
All right, you're next. I'm sorry, Lisa. How?
Okay. I'm okay.
Okay.
I've been better. I was diagnosed probably about 12, 15 years ago with endometriosis. So I had a hysterectomy and then the bladder issues, and I had on my bladder, I guess. So since then, I'm seeing my urogynecologist, and I have been diagnosed with IC, pelvic floor disorder, vulvodynia, coccygenia, so pretty much all of that. I'm at a point pretty much I treat myself at home with installations, and I was trained by a lot of pelvic floor therapists in my area. I'm in Southern California.
Okay.
So they kind of taught me what to do if I'm getting a lot of pain.
Okay.
Probably I'm not taking care of myself. I was just in a job where I had to work 60 hours plus a week, and most of that was sitting down. So it really caused coccygenia to get really bad. I went to my physical therapist, and she said that I can't treat that until I treat my gluteal muscles and some other things. So I went back to my urogynecologist because since then my bladder is out of control. I can do so many treatments at home that they don't help with creams and everything else. And he thinks that it's time for me to have another Botox treatment. So I don't know if there's something else that I should do because right now I can't walk. The pain actually is going to the fascia in between my legs and it's really tight and it's hard for me to even move around.
Well, you just said the operative point here, and that is it's hard for you to move around. And it's hard for you to move around because your muscles are tight. It's not your bladder. I mean, normally if movement triggers a symptom, it's because you're moving things. So an icy bladder itself would not cause, an icy bladder would not normally make movement painful. What makes movement painful are tight muscles and nerves and things like that, right?
And then I have a feeling that might be irritating my bladder.
It would be.
Seems to happen. Yes.
It would be. That's a visceral reflex. So you got two fundamental reflexes in your pelvis. You've got viscerosomatic, which is, can a organ change the behavior of a muscle? And the answer is hell yeah. If you're in pain, your muscles are going to get tight to protect you from the pain. So if you have an attack of Montezuma's revenge, if you have an attack of vulvodynia, if you had painful intimacy, if you were raped, if you had a UTI, all of those things are going to cause your muscles to get tight. We are designed that way. We are built that way to guard in pain. But, and so your history of endometriosis, the fact that endometriosis is so painful, especially.
Well, actually, I had a hysterectomy about over 12 years ago.
Okay.
So,
but even before that, you had the hysterectomy because your endo was hurting.
Yes.
Okay. And so you've been guarding for a long time. Your muscles have been tight for a long time. So
also, I have IBS, which does not help out with IC.
Well, I know, but the connection is muscles and nerves between all of them. They all influence each other in the pelvis. So here's what we know. You had painful endometriosis. It hurt like hell. You eventually had a hysterectomy, and we know your muscles are in a tight guarding pattern. We know that. The question is are they stuck there? And so your question is can your muscles change organ behavior? And the answer is yes. The long-term consequences of tight muscles is it restricts blood flow. It compresses nerves. And so, I mean, if your muscles are tight, I can't shake a hand with tight muscles. I have to relax, right? And so if your muscles are locked down in a tension pattern, everything it's not going to work
in the
well.
past, light water aerobics helped me, but now my doctor doesn't want me to go in until after I have the Botox because he said the chlorine can affect my bladder.
So
affect my outside symptoms.
The outside symptoms are in all likelihood being influenced by tight dysfunctional muscles that are restricting blood flow. Right? You have to assume, there was a great study, and I wish they would do this with pelvic floor, but for people with pelvic congestion syndrome, they did a blood flow study. A normal bladder is infused by 24 units of blood. In pelvic congestion syndrome, the average was 9 units of blood.
Oh my goodness.
So I want you to think about what the toll of restricted blood flow would be to your bladder. If you're supposed to have 24 units of blood and you have had tight muscles for at least 15 years, if not probably 20 years, has your bladder ever received a good enough blood to be truly healthy? And the answer is probably not. Probably not. That's what happens when you have tight muscles. It restricts blood flow and it has the potential of compressing nerves.
And it's odd because I was in remission. I've been in remission for 6 months, a year maybe at a time, but this time it just came back.
but think about that for a moment. So you are living proof that remission happens. The question is what made the remission go away? And what made your symptoms go away? And the odds are it was because your muscles were probably relaxed. You were probably doing things that relaxed your muscles, and now you've started doing things again and have gotten your muscles back into a contraction pattern. Or you had,
and it's hard when we need to stay in. You can't walk around as much. It's really getting tough for me.
It is. Yeah. So, you are the perfect example of the ripple effect, and the ripple effect in the pelvis. I think it would be improper for anybody to say you are a simple IC patient, because you're not. You're not. You had endo. The endo could have affected your bladder. It could have attached to the outside of your bladder. You certainly had intense pain, enough to drive a hysterectomy. We know your muscles were tight, not only from the pain, but we also know your muscles were traumatized by the hysterectomy itself. And
then I'm getting nervous in the middle of last night. It was starting to affect my legs and my foot. I got really bad pain that it woke me up.
But now think about that. That's not your bladder. If it's affecting your leg and your foot, these are tight muscles compressing nerves that innervate your feet and your knees. You need to get this book. You have to get this book. Because you've got to understand your anatomy here, because I have a feeling that all of your other symptoms are being driven by, potentially tight muscles. And so I would want a pelvic floor assessment. I would want to work with a physical therapist. Let's see if there's anything funky going on. And you've got to tell them that the pain went to your knees, the pain went to down your leg, to your knees.
I just need to make another phone call because I've been seeing physical therapists on a regular basis.
Right. So it's time to do that. And I'm very comforted in the fact that you've had several remissions. And what that means is that your muscles are capable of relaxing and your bladder is capable of calming down when the muscles are relaxed. Right. So, again, chicken cause and effect. I'm not God. I can't predict the future. I don't, or the past. I'm giving you my best guess. But the linkage here, really, you cemented it with the pain down your leg. That's muscle and nerve. And so that's where I would be spending my time. Okay?
Okay, now, do you recommend Botox? What do you know about that?
Do they want to do it in your pelvic floor or do they want to do it in your bladder wall?
Both.
If your muscles are so incredibly contracted that they literally are too painful to work with and Botox will improve that, then that makes sense there. But Botox always comes with risks. And that is that you might have to self-catheterize afterwards if they,
Well, I've been doing that on a regular basis anyway with treatments. But I know I don't want that to happen.
Does it help you? Does the Botox help you?
I had it a year and a half ago,
and did it help?
It helped. Once in a while, I need to do manual physical therapy or just an installation here or there, but it seemed to help. So I don't know if that's what helped or it might have been something else.
No. You're doing what a lot of patients do. You're looking for one thing to fix it all. And that's not going to happen here. You have an underlying muscle issue. You have an underlying nerve issue and that you also have a bladder issue. Don't expect one therapy to fix it all. Okay. So the pelvic floor, the goal of the pelvic floor physical therapy is to restore muscle tone. And we got to figure out.
She told me to do a lot of manual massages in my thighs at home.
Good.
So I need to do that before I should go back because she can't do her job until this takes place.
I hope you have a foam roller. Are you rolling on a foam roller at home? Do you know what that is?
No, I'm not.
Hold on. Let me get mine. Oh, see, my leg is tight now. When you're trying to work on This is the bomb. I rolled on it today for about 3 minutes because my left glute gets so tight. And so you just put it on the floor and you roll it up and down the length of the glute, and your physical therapist will teach you how to use it. But this is glute 101 right there.
Awesome.
Order it on Amazon.
Thank you so much.
Okay, hon, nice. But talk to your physical therapist. Make sure your physical therapist is okay with you using it, okay?
Okay, thank you.
Okay, see you later.
Bye, thanks.
Okay. Now, I've got Holly and Lisa. Lisa Beth, we did you, right? Okay, that was you. I'm sorry. I'm switching around and I can't see names on this. Holly, are you there? I don't have a picture for Holly.
Oh, sorry.
That's
yeah,
okay.
We talked, I did a session with you. I was just listening.
Okay. Do you have any questions?
Well, I never received my wand, but I figured it takes time.
Oh, did you order a glass wand from us?
When you and I talked, you ordered it for me.
Hold on. I don't remember. I actually don't remember that, but I'm like running.
Oh,
like
that's okay.
I'm running like a chicken with my head cut off right now, to be quite honest. So.
Well, when I sent you those tests where it said it was 30%, I'd sent you my DNA test from like a year ago, and where the doctor was yelling at me because why are you having these kind of tests? Do you remember that?
Yeah.
Only people who are really sick. And I sent them to you. I wondered if you were able to see them and what you thought.
Let's talk offline about that.
Okay.
I don't.
Right.
So you say you ordered a wand?
Yes. You asked me, do you want the long one or the short one?
I don't have. Your last order was on July 22nd, and it was not for a wand. There was no wand in there.
Oh. Okay.
Okay. So call me tomorrow. I actually, or pop me an email because I normally try to take Monday off, although I haven't been able to. And let's work it out. Okay. We'll figure it out.
And I'm going to get a block in about 2 weeks.
Okay.
The block just to see my physical therapist thinks that's what my problem is.
Cool. All right.
Plus, but what you're saying is two things going on at the same time really crystallized for me today.
Yeah.
Because also the estrogen driven, and I'm doing topical, that plus both. And, I did go a year with no symptoms after I did everything plus the diet.
Right.
So those three things, when you just said that was just crystallized for me.
Good. Okay.
Thank you.
Have I missed anybody in the chat, in Zoom? Lisa, I know, was just listening. She didn't. Lisa says, what is the next generation urine test? It's a test that will studies DNA of anything living in your bladder, and it will identify it will identify good bacteria, bad bacteria, and fungal infection. And if you go to a website called bladderhealth.org, you can learn more about it. All right, I'm going to shut down the Zoom meeting. I'm going to go back to Facebook. I have some more door prizes, and so I have more bottles of Allopath. I've got.
Hey, Jill.
Yeah.
I want one. Hey, Jill.
I sent you one.
Hey, Jill.
Okay.
Yeah.
I've got something to send you. Don't forget, you asked me to send you something. I'll send it at the end of the week.
Okay. So
it was those four things that we were talking about.
Okay.
Okay. I will send it to you email. I know. I'll refresh your memory in it.
Okay. Okay.
I know you got stuff going on, but I'll refresh your memory. You know I will.
I have 6 or 7 more bottles of Allopath that I'm giving away. And so for anybody who wants to try Allopath, send me an email, icnetwork@mac.com with your mailing address. Donna, I know you were on the list. I absolutely know that I sent you a bottle for sure. I sent out about 20 bottles last week. So, okay, I'm going to shut down Zoom. I'll see you guys later. Thank you.
See you.
Thank you.
All right, Zoom is done. let us come back here to Facebook and YouTube and see if we have missed anything. All right, guys, the same thing goes for Facebook and YouTube. If you would like to try the brand new Allopath, which is something I'm really excited about it because it combines aloe with PEA, I am giving away more bottles. And all you need to do is email me your snail mail address, icnetwork@mac.com, and I've got them all wrapped up, ready to go in their the temperature control wrap, so they are ready to go. Joe says, what percentage of people who take Elmeron will get eye problems? Our survey of 2,000 patients report 54% of those patients say that they now have retinal problems. In the clinical studies that were done, one of which was up here in Northern California at Kaiser Permanente, they did a survey of patients who were currently taking Elmeron. They did not assess people who had stopped Elmeron, but of the people who were currently taking Elmeron, 20 to 25% had visible damage on their retinas. What have I missed? I'm sorry, you guys. Patty says, we are in the same storm, but not in the same boat. Isn't that true? Thank you, Andrea. Andrea says that Zoom was wonderful. Thank you. Yeah, you're getting an eye into what my daily life is like, you know, answering the IC Network phones. And when you guys, you know, the way the IC Network phones go is it's first come, first serve. There are times when you can ring through our 800 line and get right to me. And then there are times when I'm busy and I might not be able to call you back for a couple of days. They're entirely free, especially if it's a short question. If it's a longer question, you want to spend some time, it would be great if you could sign up for a coaching, which does cost $50, but I kind of think that my time is worth it, hopefully. But anyway, I always end my discussions, the free convos, when I can do them, is I always say, if you found this conversation helpful, please think about making a donation to the IC Network or becoming a member, because that helps pay for these streams and all that sort of good stuff. So again, all right, you guys, you wonderful people out there, I hope that you have I got to give you your homework. All right. And I'm going to try to put together the IC awareness stuff tomorrow. My email, icnetwork@mac.com. If you would like a free bottle of Allopath, icnetwork@mac.com. They are packed and ready to go. Okay, so let's end this with your homework. For 15 minutes a day, I need you to do something for your soul and your spirit, especially now. Oh, wait a second. Okay, and I know I'm already losing people, and that's fine. Guys, if you're not aware, President Trump has just signed an executive order that will potentially undermine our disability insurance and Medicare. Be angry, be very, very angry. Guys, you got to get involved. This is not okay. We paid into Social Security. They should not take our benefits away. This is not an entitlement. This is exactly what we feared, exactly what we dreaded. So please, 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 if you want your Social Security to live on like I do, and you want your Medicare, you all better start acting out and reaching out and telling people this is not okay. Okay, for 15 minutes a day, I need you to do something for your spirit to give you comfort, especially now in the time of COVID, because this is a crazy time right now. For 15 minutes a day, I need you to do something for your bladder, your pelvic floor. I did it before this. I spent 30 minutes doing my pelvic floor work. For 15 minutes a day, I need you to improve your noggin. I need you to improve your knowledge level. The great news here is that you've already been here, and so you get a pass for today. You've just attended a very complex lecture on IC. And then for 15 minutes a day, I really want you to laugh. Please go watch TikTok videos, or although I'm not quite ready to go TikTok again until they fix it. But YouTube, let's get some laughter in your life, or come on over and join me and play some computer games. I love computer games. This is how I detox at the end of the day. I love playing Fortnite. I love playing World of Warcraft. If anybody out there wants to just do something totally different, which is what I have to do to try to, you know, when you spend 8 hours or 7 hours talking to people on the phone, you need to do something totally different to get your brain to shut down. And the way I do that is I play computer games, and I have a whole group of adults and veterans that I play with, and then I have a whole group of little kids that hang out too that are really fun. I get to hear the laughter of children for 30 minutes every now and then. So I love that. So anyway, yeah, Donna, I agree. He is, but we won't say that. All right, guys. I wish you well. Peace, hugs, love. You are not alone. You are worthy people. And I wish for you that you have a great week, that we get some more answers, and that we can find some hope for you. Carry hope in your heart, my friends. Carry hope in your heart. All right. I will see you later. Goodbye, Facebook. The ending? Yep. There you go. All right, YouTube. Donna. Yeah. Girl, we should turn on the Zoom meeting and vent, but not tonight because I got to go fix dinner. Well, I need just to have a therapy session about how to deal with the chaos right now. All right, guys. I will see you later. Have a good one.